Good afternoon. Welcome to the June 19th, 2018 Polk County School Board Work Session, and we welcome all of you here today. I know that we've got quite a robust audience, and so Superintendent has made arrangements for extra seating in the superintendent's small conference room. If any of you would like to meander around, and then there'll be staff there to show you where the conference room. It's basically directly on the opposite side from here. So if anybody would like to have a seat, you're welcome to do so. If you want to just stay with us and stand, that's okay too, whatever works out best. Okay, thank you all for coming today. And at this time, I'd like to ask our superintendent to lead us in our work session discussion items.
Okay, good afternoon, everyone. Glad to see everyone today. We're going to begin with Melissa Brady, and she is going to bring forward, we have 2 items on discussion, Edward Bach, and we have Language and Literacy Academy. And Melissa is already seated and ready to go.
Good afternoon. Today I'm bringing forward 2 contracts. The first one will be the Bach North contract. I wanted to share with you some of the substantive changes that were made to the contract. So we'll just, if you would, refer to the document that was attached, and it was named substantive changes. You should note that on page 11 of the contract, where the section for students, this is where we spent a lot of time and effort in making sure that our language was very clear here. So I'll just read it out loud for the sake of the folks in the room. So this portion of the contract now reads, the school may provide enrollment preferences as allowed for in section 1002.33, section 10 Florida statutes. Further, the school may limit the enrollment process to target specific student populations as set forth in section 1002.3310E Florida statutes. For the term of this contract, the targeted student population will be those students residing within a reasonable distance from the school. No students living outside of the defined reasonable distance shall be accepted to the school until 100% of the students living within a reasonable distance are accepted. Reasonable distance will be defined as the former Lake Wells High School zone as depicted in the district's attendance zone map attached as Appendix 3. The school may also give enrollment preferences to the student populations identified in the provisions of Statute 1002.3310D as described in the approved application. That portion of the language refers to those groups that are written in statute, for instance, employees' children, governing board's children, and so forth. There was a question about how the district would monitor that enrollment process and making sure that that's what was indeed happening. On page 15 of the contract, in number 9, it states that the school must maintain a record of all students who apply to the school, whether or not they have eventually enrolled. The information shall be made available to the sponsor upon written request. However, such requests may not be made until after October survey period. The school shall maintain documentation of each enrollment lottery conducted. Such documentation shall provide sufficient detail to allow the sponsor to verify that the random selection process utilized by the school was conducted in accordance with section 1002.3310B Florida statutes. Records must be maintained in accordance with the applicable record retention laws. My office will request this information in writing on November 1st of each school year. Thank you.
Are there any questions?
That all sounds very good, thank you. Is that just general, is that something we're already doing for most charter schools?
The request?
Yeah.
Yes.
Okay, go ahead.
With the new contracts, all of the new contracts have that identical language in it.
Okay.
So every school that have been brought on to the new standard contract, we will be requesting this information.
And could you tell me again, when we talked about this before, there was an ESE projection number. I just wanted to remember what that was. It was pretty high. It was like 18% or something like that.
I don't recall. I don't recall what the number is.
Okay. All right.
Any other questions on Edward Bach? Ms. Cunningham.
Thank you. I just want to say publicly that I'm thrilled that we've come to this point. I know that how important it is for the Lake Wales community to be able to offer a Bach North, and I know a lot of work and preparation has been done. And I just want to thank the parties involved, because that first contract was something that we could not approve, but once it went back and things got changed, with some of the language that we're talking about here today, I think most of the board's concerns have been addressed. So I really believe it's a win-win for our kids, for the Lake Wales Charter System, and for the Polk County School Board. Because ultimately, as I always say, it's all about the kids. So thank you for going back and doing your due diligence and creating a contract that works, especially for our children in the greater Lake Wales community. So I just want to say thank you, and Ms. Brady, thank you for all your time and effort, because I know you are our liaison and you work very hard and diligently on behalf of our students. So thank you, ma'am.
Do you have any other questions on the substantive changes of the contract? I did provide them if you would, or would you like me to go through them all?
No.
Okay. The next contract that I'd like to bring forward is Language and Literacy Academy. They are requesting a 5-year term. There are no substantive changes to the standard contract. They will be closing the private school and are intending to open Language and Literacy Academy in August. Are there any questions about Language and Literacy? Yes.
When will the private school be closed?
It is closed.
It is closed, okay.
Mr. Harris?
And that is new since we last met,
Yes,
because I understand that they were planning on keeping it open.
that is correct. That is different since we last met.
Can I just, just for the record, let me just make it clear. So our career, let me just call it out what it is. Our career-centered academy is a school that will remain open for high school students and is moving to another location. Language and Literacy Academy has no affiliation with that group. They have their own EIN numbers, their own Florida business tax application, their own unemployment tax number, their own bank accounts now. So they have completely split from that entity.
And who is head of that school?
The Language and Learning,
No, the other one.
The other one.
that is still Sharon McManus, from what I understand.
Mr. Townsend, then Ms. Cunningham.
Is there any restriction on business they can do to, I mean, could the private school be a vendor for the public school? Is that
Say that again?
could there be a vendor relationship? Could the private school be some sort of vendor for the charter school?
It wouldn't
Is that-
necessarily be the private school, but it would be the private entity, the rehab center. They could be a vendor to the school.
Okay.
Ms. Cunningham, then back to Ms. Reynolds.
Question, so as I understand it, then they have separated totally, and are they opened up as a new 501c3?
They, well, from some research that we've done, and Wes can help me with this.
If
answer.
they have opened up as a Florida not-for-profit and are applying for 501c3 status.
Applying for
Yes, ma'am.
501.
Yes, ma'am, but they have opened as a Florida not-for-profit.
Back to Ms. Reynolds, then Ms. Harris.
You mentioned that
I'm
the
sorry, Ms. Fields.
private school will be moving locations. When will it be moving? Has it already moved?
They have a new address, and one of the things that we required are, address changes for Facebook and Twitter and all of that, so.
Do you know where the new address is?
I do not.
It's not like the building next door?
No.
Do that, okay. There is a building right next door that has their sign.
Ms. Fields?
I think it's unfortunate that there's been so much confusion on the separation. And so I think we just need to be assured that there is separation and that it's no longer a part of the initial school. I think that's the bottom line here. And my understanding is that they've done that. Is that correct?
That's correct.
Any other questions on language and literacy? Okay. Thank you, Ms. Brady. The next item that's going to come before you is a presentation, as you know, as part of the new legislation. We have to have a plan that's submitted to DOE in August. So I'll give them a minute to
Give them a minute for everybody to.
walk down.
There we go.
Yes. There's one for each of you. or whoever needs one.
So Hazel, would you pass one back to you? Thank you.
So in response to Senate Bill 7026, part of the bill requires that we have a mental health plan that's to be presented to the State Board of Education and to DOE in August. What's coming before you today, what Kimberly is bringing is a draft that we have been working on, and she's going to present some of the elements, as well as Jim Maxwell, regarding our mental health plan. They have been working with some of the surrounding agencies, which I will not go into depth anymore. You'll hear more about that during our presentation. But I wanted to make sure you understand this is in response to Senate Bill 7026. So I'm going to turn it over to Dr. Stanky and Jim Maxwell.
Thank you. So Ms. Barr did a great introduction of why we're here. I will tell you that our team's been working really hard over the last several months to put this together, a lot of research, planning, talking, discussing things. I'm personally really excited about what we're doing and how it's moving forward. I think it's going to provide some great opportunities for our students and our teachers and staff to meet some very challenging needs that we've had in the district. So to get us going, we're first to talk about what are our goals for the plan. Obviously, the very first goal is that we have to meet the legislative requirements under Senate Bill 7026, which require providing an increased access to mental health services for our students. So obviously that's a goal. We also want to provide, as a part of the plan and requirements, increased professional development and support for our teachers and our administrators and other school staff in the areas of threat and risk assessments, which are huge pieces of the legislation, youth mental health counseling and first aid, and behavior support. And then obviously we want to ensure that through our plan that we are being efficient and purposeful with the use of the mental health funding allocation that we've been provided. So when we talk about the allocation, the district was allocated roughly $2.4 million. We have a proportionate share of that, obviously, that goes to the charter schools. So when we subtract that out, our ending allocation for us is a little over $2 million. Per the statute, 90% of that has to be spent on two main things: providing mental health assessment, diagnosis, intervention, all these things for students, and coordinating those services with the student's primary care provider or other mental health providers. Those are the two main pieces of how the money has to be spent, at least 90% of it.
Senate Bill 7026 requires a lot of things of the district. I found it easier to categorize all those requirements into two main groups. One group is about responding to shooters. That's the piece that you're probably more familiar with, putting armed personnel in schools, hardening sites, that sort of response to active shooter drills, those things. The part, and that's safe schools, that's not us. The part that's us is another section of 7026, which works like this. One way to make safer schools is to respond more quickly, more efficiently to possible shooters. Another way to make safer schools is to identify students that are troubled, students that are at risk, and provide them services so that they never actually become a threat to others or to themselves. So that's the overall goal of all of the pieces of our plan, to provide safety through prevention and intervention. So 7026, in that piece of 7026, wants us to expand our services that we provide to students with mental health difficulties, provide additional support for threat assessments and risk assessment teams, coordinate the services with the parents and other primary care providers, and then utilize direct service providers. Either we can use the money either to hire people ourselves and provide services that way. We can form collaborative partnerships with local community mental health providers, or we can engage contract-based providers. Our plan, you'll see, actually uses all three of those options. Another piece of mental health component is that we provide awareness training and professional development to all of our staff. And you can see the logic of that. If you're trying to build a system that recognizes students that are at risk, then you have to train people in regards to what that looks like. So that's what that piece is about. And then there's, of course, a data reporting piece for the Florida Department of Education. So our plan. Here's the highlights of our plan. We are integrating the mental health services into the MTSS framework. That's actually recommended in the 7026, and so we're doing that. You guys are probably familiar with the tiered services, but the idea is you have a system of support that is good for all students and is largely preventative and educational. Then some students are going to require additional support. That's called Tier 2 supports. And then there's a few students who will require intensive, very specific, very detailed, and very resource-intensive supports. Those would be students that require Tier 3 services. So that's, you'll see our plan incorporates that framework in our provision of services. The next piece is that coordination piece, coordination and collaboration. We are talking about using our already existing SEDNet personnel and other school personnel to coordinate with community service providers and the other government agencies. Some of our other community service providers, we've had a long partnership with all of these. Winter Haven Center for Behavioral Health, Peace River Center, Tri-County Human Services, it provides a lot of drug intervention, Polk Vision, which is part of United Way, and Heartland for Children, the overseeing agency that oversees children that are in some sort of protective relationship. We're also going to provide that targeted assessment, targeted professional development, threat and risk assessment, youth mental health first aid, which we've been providing now for the last 4 years as part of a grant program that we have going, trauma-informed care, functional behavior assessments, and behavior intervention plans. Those are plans that are used with students with very significant difficulties. And we are going to hire personnel in order to improve our capacity to do these things. So, little interlude. So why are we doing this? What I would like to suggest with the content of this slide is that mental health is important apart from meeting the requirements of Senate Bill 7026. It's important. It's important to us, to our community, to our students in schools. Nationally, 20% of all students will have a significant mental health difficulty this year. So if you do the math, it's easy. We have 100,000 students. 20,000 students will have their educational process interrupted by mental health difficulties. Those students are at significant risk for a variety of negative outcomes, behavioral and social problems. Many of the students we're sending to the office and expelling are in fact students with mental health difficulties. We're just not seeing them that way. Attendance and school dropout, juvenile justice involvement, substance abuse, and they're also at risk for stigma backlash. I think because of the way the news reports, it's easy to conclude that if you have a mental health difficulty, you're going to go shoot up a school. Well, that's just part of the stigmatizing process of people with mental health difficulties. I'd like to call your attention to suicide. Suicide is the third leading cause of death for students aged 10 to 14. It's the second leading cause of death in the United States for people aged 25 to 34. And here's my point. Twice as many people died in the state of Florida last year from suicide as from all of the homicides put together. So all the robberies, all the murders, all the shootings, add them all up, and it's 1/2 of the number of people that took their lives in the state of Florida last year. Students, people with mental health difficulties are more at risk to hurt themselves, and they're more at risk of being hurt by others. They're not generally a significant threat. And then to leave you, 8% of the students, high school students that were surveyed in 2015 reported that they had, in fact, attempted suicide. So, back to the plan. So this is how we're actually going to implement the plan.
Do you want us to keep going or something?
Would the board like to have questions in between and let them do the PowerPoint, go through the PowerPoint? What is it?
I was just gonna make a very, very brief point, that's all. I just wanted to add that as I understand that there are more suicides in American schools every year of kids than the number of kids who have died in every mass school shooting ever combined,
That's correct.
every year.
Mhm.
Um,
And
so-
I'm not trying to,
No, there's no
in any way
minimizing it.
say that school shootings are unimportant or
No,
not important.
no, it's the
I'm
scale.
just trying to put
Yeah.
mental health in a perspective, in a context. So, how are we gonna do this? This is the specifics of the plan. Well, we talked about the about the MTSS process, and the fundamental idea here is that students have a variety of abilities and readiness levels. And so schools, both in academic and behavioral and in mental health areas, have to recognize that, and you can't just use the same program for everyone. So, Tier 1 programs are school-wide, and those are going to be your preventive programs, teaching social, emotional, and resiliency skills, for example. Tier 2 programs are generally small group programs. You might have a grief group. You might have an anger management group. You might have a group of traumatized kids that need to learn how to self-regulate. Those would be Tier 2. And then Tier 3 we've talked about. Those are the high-intensity programs. So, core, Tier 1, focused on prevention. In addition to that, we're also, Tier 1 will include a wide variety of professional development, which I've kind of alluded to, trauma-informed care, mental health first aid, the crisis preparedness training that we provide to student services people, and referral processes and alternatives to suspensions and expulsions.
I also want to point out in Tier 1, one main thing we'll be doing, and part of our plan is a very direct and deliberate coordination with the Director of School Safety. So all the school drills and emergency drills and things that have to be put in place, our team will be participating and guiding those drills and what has to occur from the mental health side, because as students go through them, that can increase some mental health anxiety issues and things like that. So we'll have a strong partnership there.
We'll also be reporting all of our data that we collect through our people to the Office of School Safety. Tier 2 targeted, that's the small group. I have a quick list of Tier 2 services that have been remarkably successful in our target schools, but there's a wide variety. Basically, in Tier 2, if a student lacks social skills, you teach them in a small group setting. If a student does not understand emotions, cannot regulate themselves, you teach them the skills to do that. That's Tier 2 kinds of responses.
This is also where a lot of our collaboration with our community agencies that we're already have in place with most of them will continue and will impact the services that we provide and increasing them.
And Tier 3, those are the students that require intensive programs. So they are not, it's not a large number, but they require a lot of resources. What we're going to talk about here is targeted case management. We're going to talk about improving our ability to develop behavioral intervention plans for students that need them. We're going to have intensive behavior classroom units, which Dr. Steinke will talk about more in a minute. And we're involving the community and contracting services to assist us with this. And through our community involvement, we're also trying to get a daycare treatment program. You know, in Polk County, day treatment center program. Get that. In Polk County, we're one of the few districts, we don't have that. So if a student needs education, but also significant, be surrounded in a mental health environment, they have to go to another district in order to access that. So we want to develop that program here for us.
So I want to give a quick overview of the intensive behavior units that we're implementing next year. We're starting them at 3 elementary schools, Floral Avenue, Lake Ship, and North Lakeland Elementary. Those students in those units will be provided their academic instruction that they require. They will all be on a regular standards curriculum, as well as paired with very intense behavior support that they need in order to be successful. in school. We're looking at a maximum enrollment per unit of 5 to 6 students. These are I call them our tier 10 kiddos sometimes in reference to them because they are the ones that are driving the resources very high. Student entrance criteria, they are not required to have an IEP, but there should be documented intensive persistent behaviors and a lot of resistance to prior interventions. That should be well documented and in place before we consider them going into a unit. There's no specific length of time that they would remain in the unit. It's not like a 45-day removal or anything like that. It's a decision for them to be there and provide them with a targeted behavior intervention plan that focuses on supporting them and getting them prepared to return to a less restrictive environment, even with supports. And then when they're at that point, when we feel as a case management team, which involves school personnel, district personnel, community agency providers, parents, anybody that's involved in the case, feels that they're ready to progress back into a traditional school or in a less restrictive environment, then that's when we begin the exit process, which means transitioning them back into that setting with supports. It might be a half day going with support and coming back to the unit. So that's a process that we would go through.
This is not intended to be a sort of a punishment consequence for students. So it's not like someone's threatened bodily harm so they go to one of these units. This is not that kind of place. This is for students that have significant history of mental health difficulties and they express in behavioral issues, and the schools really do not have the resources to work with this kind of student. And so this is a program where we're making sure that we will have the resources to work with this kind of student.
The units will be, the oversight of the unit, they do belong to the principal. They're their students, their staff, as far as the teacher and the paraprofessional. But we'll be in direct collaboration with our team, our managers, some very specific behavioral staff. We're contracting with one of our agencies just to provide the support to these units. So a board certified behavior analyst will be a part of that leadership team. There will be a lot of targeted professional development and professional learning community work with these 3 schools and those teams. The daily staff in the unit every day will be a teacher, a paraprofessional, and a contracted registered behavior technician who is a very highly trained behavior support person. And then on a weekly basis at minimum, support will be provided by the BCBA. There'll be an assigned mental health counselor, an assigned ABIST from the ESE team, a school psychologist, and a school social worker, specifically for these 3 units. When we talk about the day treatment centers, and we are, like Jim said, in collaboration with some of our community service providers to put those in place, they will have a therapeutic focus. So the students will be there receiving their educational services from one of our staff, and the rest of their services, whether therapeutic or behavioral or both, would be provided by the agency. These would be for younger children typically ages or grades kindergarten through 4th grade. So when we talk about our plan, it will require some additional resources as far as personnel. We're talking about providing direct services to children. Right now in our district, we do provide mental health, but it's only for students with IEPs. So in order to expand that, we need more providers. The way we are proposing that takes place is that under the Director of Student Services would be a new senior coordinator for mental health. 2 coordinators under that person who one would focus on the threat and risk assessment, professional development, reporting, all of those activities, case management. And then the other one would focus on all the remaining professional development that's required under 7026. So the youth mental health first aid, trauma-informed care, all of those things that have to take place, which will be a district-wide plan. And then we would be looking at 18 mental health facilitators. These would be brand new positions, brand new job descriptions. That would be the direct support to the schools. They would be assigned on a regional basis. They would provide direct mental health services where needed. They would also help the schools facilitate the process for referring students to community agencies, case management, doing a wraparound approach for the children and their families to make sure that we have a seamless situation for students between the school and the home or outside school environment for meeting their mental health needs. The people that would be qualified in these positions, it would require that they have some type of certification or a licensed mental health certificate to be able to provide direct services. So you could be a licensed mental health counselor, a school psychologist, a social worker, a school counselor. Any of those would fit into the new job description. The budget, this is how we have it divided out as far as the allocation. Again, we started with 2.4 million, we removed the charter school allocation. We've currently dedicated about $100,000 for professional development, which would include all your material supplies, trainers, things like that. I'll explain that in a little bit more in a minute. Contracted agencies, we do have a contract in place with ABC Incorporated for the intensive units, which would be that BCBA and those registered behavior techs for the intensive units. And then we'll also setting aside additional funding for any additional contracts that we would be putting in place with our community providers. And then we come into the positions that we would be proposing to add. Of course, it's all contingent on the funding coming in on an annual basis. But that comes down, we're also adding an office system specialist, I don't think I mentioned that earlier. And then the paraprofessional for the date treatment center would also come out of this allocation. The teachers would be FTE based, but the paras would come out of the allocation. So if all goes well, we'd be spending almost all of the allocation. The professional development kind of breakdown, we've right now categorized it into two areas. One is what we need to provide for the intensive units, about $25,000 for, they do have to be trained in CPI and professional crisis management because they will be restraining students. Other additional behavior support strategies that are from a team approach, and of course case management and IEP support. And then the district-wide professional development we're looking at currently, as Jim said, we've been doing the youth mental health first aid through our Mindful Schools grant program, but we're believing that that will probably be the program that the DOE requires districts to use. We're just waiting to hear about that. But we'll also provide threat and risk assessments, more CPI and trauma-informed care, amongst some other things. But we have a meeting coming up starting tomorrow, so we're waiting to see a little bit more about what the professional development needs to look like and how we budget it. So we figured a lot of people are asking, what are other districts doing? That was one of our first questions because we wanted to know, what are you guys doing? What does your plans look like? So we reached out through our networks to a variety of districts. Some are very far along, others are behind us. But one thing we can say is that everybody's pretty much moving in the same direction. Everybody's building their structures for the most part under the MTSS framework. Everybody is utilizing their current resources as far as personnel and staff to the extent that they can. Everybody is using agencies they either already partner with or are bringing more in. Some are contracting with companies. And pretty much everybody is also adding additional positions for more direct support for their students in their programs. We did put in the folder a green piece of paper that gives you kind of an overview of the different districts and the feedback we've gotten from their draft plans as well at this point in the different areas and how they compare to ours.
One district, just as a side, is also purchasing a database to manage the information necessary to send out to the state. Thought that was kind of interesting.
We think we already have that covered. So our next steps, as a part of the legislation and where we go from here. One thing is we have to update our code of student conduct to reflect the mental health requirements. I know Mr. Butler's already taken care of that, and that's already in process as a part of the new mental health, or the new code of conduct.
And I think you'll hear more about that in just a few minutes, actually.
We're coordinating with Ms. Brady and the charter schools because they all are also required to submit a plan if they want to use the allocation. So we've given them a deadline to get those to us so we can review them and make sure that they meet the legislation. They do have to be approved by their boards before they come to us. So we're working with them. We're working on our MOUs and any contracts that we would have in place with our community agencies. Some we already have, some we're tweaking. As I said, a team of us is leaving in the tonight or in the morning to go to Tallahassee for the next 2 days because there's a state meeting to go through the mental health plans and people to give feedback and see where you are as far as meeting the requirements. We'll be able to look at other district plans and hopefully get the information about the training that's required. We are required to have this approved at the next school board meeting on July 31st. So when you see this again, it may look a little different format-wise, because one thing we have learned from the other districts is their formatting there was no template given to us from the state. So we all kind of came up with our own format. But what a lot of people are doing, and we think we want to do, is go back a little bit through the legislation, kind of format it to answer the specific questions and requirements in that way. So the content will be the same, but it may look a little different visually. There's also a link to the staffing plan because of the positions we're requesting, so that piece would be in there too. So when it comes to you on the 31st. And then we're required on August 1st to submit it to the DOE. Ms. Bird will have to, there's a checklist she has to sign, that it includes all the requirements, the charter plans. And then we go from there.
And before we open to questions, one thing, and you might be wondering why we focus those schools in the elementary area. As we went back to look at the data, what we saw coming out discipline-wise, we have seen an uptick in the elementary behaviors. And talking to other superintendents across the county, across the state, the same thing that we're seeing. Not that we're not going to address the secondary behaviors, because we're discussing that and putting a plan in place for that as well. But more of the uptick is at the younger ages right now at this time. So that's why we're looking. You also see there's 3 areas you might wonder, well, what about the other side of the county? We brought that to the forefront as well. That is, we're starting to look at where would that next site be if we have to get that site up and going. So those conversations are already in the works and in place as well. So, we're trying to think about all the areas where they are, but you have to put the services with those kids. And most people say, well, that's only 5 or 6 kids. Well, when they have mental health issues and the great needs that we see that's happening today, 5 or 6 kids can sometimes be like 12 to 18. So that's why we're putting a lot of services into those.
The other thing is that we're starting with 3 because we want to do it right before we expand it bigger. And so a key to the units is, one, ensuring that the setting is accurate. There's some physical space that has to be required for units of that sort. Of course, we look geographically as far as transportation and where we could, move students. Had great collaborative conversations with the principals and the regional assistant superintendents before we said this is a go, and just talked about it. They asked, lots of great questions and talked it through. Principals are right on board and hiring their staff, and it's going to be good.
Questions? Ms. Sells?
First of all, I love this, and this part about the elementary, I know the great need for that. And while it looks like an expense, it was already a huge expense. Many times, one child in one elementary school was taking an administrator's complete time during the school day. They had those kind of severe mental issues. So really, this is going to be a cost savings as far as the time and effort put into these children. And of course, they're getting many more services, because many times that administrator was just keeping them safe from other kids. So I appreciate that. What I wanted to ask was, sometimes with this money allocated, this is a very comprehensive plan, and if a charter school who just gets a tiny bit, if they wanted to give that to us, could they be part of our plan, and you give them, they have access to the training and to the services if they would wish that?
That has been proposed to us, actually.
And it's funny that you asked, because that's we have a list of questions actually that we're taking with us tomorrow, and that is one that we've asked. I know Melissa's also had proposed that to Adam Miller at the charter school office at DOE, but I'm not sure. That's exactly one of the questions we have.
Is that something the state would have to approve or not approve?
The requirement, as far as we know it right now, is that they have to have their own plan if they want to use the allocation. So if they don't, then I would think that falling under our plan,
That they could follow?
I'm thinking that they can.
I'm thinking some might want to do it, because you've got a great plan
Right.
here, and with a little bit of money, you can't offer as a little school the comprehensive plan that
Right.
would come up.
I'll just ask Mr. Bridges maybe, we have we have a contract relationship with every charter, and we withhold a certain amount of their FTE money for the services that we provide, busing and the database, for example. And these would be expensive services perhaps. So I don't know how we would solve that particular issue.
I would, and I'm glad you all are gonna ask that question tomorrow, because I think the way I interpret the language, that everyone had to have their own plan, just like we had to have with the school safety plan, that they had to come up with theirs as well.
Right.
And if they fall into our plan, how does those numbers impact our numbers?
I understand
That will be my concern
Right.
at that point.
Okay.
So because we're looking at what we had just in our public school system setting, not outside what the uptick we had. I don't know what their uptick is, but I would think, if I'm interpreting the plan like I did school safety, they have to have their own plan. But it's a great question to
Yes.
ask when you're.
That's something we're gonna really try and clarify
Yeah.
tomorrow.
Okay,
Thank you.
okay. I think Ms. Reynolds, then Ms. Cunningham, then Ms. Fields.
As far as the intensive behavior units, are you expecting them to be full in 18-19, or how quickly do you think we'll be running out of room and need more units?
There is the philosophy, if you build it, they'll come, of
27
course.
days.
The way we're kind of starting it out is, we have a group of students that, as Ms. Bird shared, have been taking up a lot of our resources and time at schools. We have not made any specific decisions about any of them, because for most of them it'd have to go through an IEP team. But we have kind of looked at them, where are they in their progress, what supports are we already providing for them? Would moving them to a unit, or considering moving them to a unit, be a better situation for them versus leaving them where they are and just adding additional supports? So we're kind of starting out. We know that 2 of the units at this point in time are projected to start around 4 or 5 students. But the other thing we also know is that, especially in the world of ESE, a lot of times over the summer, kids move, kids transition, and the students we looked at, in May may be very different than the ones we have with us in August. I would anticipate that, yes, they would fill up generally pretty quick. But I also know that we will be very diligent and very specific on ensuring that the students that are placed in this environment are the ones that truly need it, because it will be the most restrictive placement that we'll have. And our goal is always to have students in a less restrictive environment, even if it means the support's there, so.
And we can't place anyone until we are fully staffed and the staff is trained.
Right, and that's a good point, thank you, Jim. We have made the commitment to the schools that no students will be coming until your teacher and your para are both hired, your RBT is in place, and all have been through the required training that we're putting in place. So
Team training.
all 3 units, may not legitimately open on day 1 if the teachers haven't been hired.
Okay. And then also, I just wanted to make sure, I know it's noted in our plan, but this money was not recurring in the budget, it was,
It
Just
uses
for
the word
this year,
recurring.
so
The
we-
word recurring is in 7026.
okay, it is.
Well, we're-
That's a question, that's another question that we,
Okay,
we're assuming that it is, because I just feel like this is such a need that everybody knows. Legislatively, somebody
Yes.
come in and wipes it out, that's career
yeah,
political suicide, I'm thinking, but
you know.
you never
we got a
know,
lot.
never know.
You never know.
Ms. Cunningham, and then Ms. Fields.
I was just going to make a mention noting where the schools are, the current ones, Florals in Bartow, Lake Ship, Winter Haven, North Lakeland, and Lakeland. There's nothing on the east side of the
Yes.
county on the 27 corridor.
Mhm.
So that's troubling, because we have students that have those issues as well. So my hope is that when you decide to open it up, that the next place you place it is someplace on the east.
And we are.
Because I'm assuming the way those particular schools were chosen is because of the need and the referrals from this past year, am I correct?
Yes, ma'am.
And the issues that go on. Okay,
Yes.
all righty, thank you.
Ms. Fields.
I just wanted to know, is there funding for additional sites is needed? Is there money in the budget for that?
Intensive units?
Yes.
There could be. The units are, the teacher and the para are local funded monies because they come out of FTE. The contract for the support comes out of this funding, but if we had to, we could also pull it out of IDEA. And I'll tell you the reason that we specifically pulled it out of this funding is because this is gonna give us an opportunity to start billing Medicaid for behavior support, which we do not currently do, so that we can turn it around for revenue. We can't do that right now with our behavior support because we pay for it all out of IBA. But that's why we're doing this contract here. And then the mental health counselors, the school psychologist, all those are coming from our current staff or our current contracts. So it would just be a matter of increasing those where needed.
Okay, and then the implementation timeline, do you have a timeline as to when all the training and the hiring the staff will be done? Are you working on that?
Well, the training that we have to determine first is what is the state definitely requiring and what does that look like? As far as we know, it's some type of mental health training for all staff, which obviously would have to be done, as quickly as possible. But when you're talking about 13,000 employees, what would that look like? I'm anticipating that within the first year, they're gonna give us a year, they've got to. I don't know how districts could, maybe a smaller one, but not us. And then, what was the other part of your question? Sorry.
Just
Timeline.
Oh,
timeline.
And then the hiring of the positions, of course, as long as the staffing plan is approved, is what we've proposed. And the positions are built, and we advertise and hire as quickly as we can.
The training will be ongoing though, all throughout the year. Trauma-informed training is a training that we want to provide or make available to a wide number of schools. So we'll be providing those workshops whenever we can access teams from the schools.
Any other questions? Mr. Townsend?
So, these three schools, the kids are gonna come from other schools as well,
Yes.
these are, okay. So, is there an existing, like, how do you, is there an involuntary quality to this? Can you be involuntarily sent to does a parent have to agree? What's the mechanism? No.
Legally, do they have to agree? No. We could assign them to the school as their, either through a process or Ms. Bird as superintendent could do that. Based on my experience in these types of situations, generally the parents are already so involved in the process and know that their child needs so much support that they're such a collaborative part of the team already that they get to a point where they're anything to help their child be successful in school, they're willing to do. We also, one of the factors that we will look at is how long would the child be on the bus? So, and that's where it comes into when you're looking at each individual child, what's best for them, going to a unit or staying where they are with supports. And it's a collaborative process. We obviously definitely want the parents to be supportive and a major part of the team, because that's the only way it's gonna be successful for the child.
Is there parental demand for this now? I mean, are there parents, are you talking, so we identified some kids, it sounds like, are the parents interested in this? What's the?
The parents are just, we know through working with them in different situations, they want help for their kids.
Right.
They want their kids in a school where they'll get the help that they need, they'll feel welcome, they'll be a part of the school. That's what the parents want. Do the ones that we're considering for these know specifically about these? Not at this time. We haven't approached the individual students or anything.
No, I mean, there's, I don't know that there's a precise right answer for it. I just wanted to.
Well, they want their children to be more successful, and they know they're not right now.
Quick last question on the charter aspect. Have charter schools actually approached us about partnering or whatever?
Yes.
So
We have.
they've actually reached out to us about it.
At least one has asked that specific question.
Okay. Thanks.
Any other questions? Okay,
Thank you, ma'am.
thank you. Next up, we have the Florida Blue Amendment. I think Mr. Barone has members of Florida Blue, they're here.
They're not in the room just yet, I think
Oh, are they over there?
Are they over there?
they,
Okay.
hopefully they're watching.
Okay. Some of them saying is there a PowerPoint? Okay. Do you have the thumb drive?
Jan. I should have it.
Okay.
Robinson Bush.
You want a quick 5 minutes for setup?
Might help.
Okay. We can take So we're gonna reconvene and we're gonna begin back with Florida Blue. Mr. Barone, so we're ready.
Okay, so we were approached with a unique proposal from both Florida Blue and Blue Cross Blue Shield of Alabama. We have Jan Bush from Robinson Bush, who has a PowerPoint. It's not going to be up on the screen. She handed it out at your desk. And we also have Michael Warner from Florida Blue. So if you have any questions from him after, but if Jan can go through the proposal and our subsequent recommendation of this, we'll then take some questions on this proposal.
Thank you, Mike. Good afternoon, Board.
Good afternoon.
So as Mike said, Florida Blue has come to the Polk County School District with a proposal that really creates this partnership with one of their sister Blue Cross Blue Shield Association plans, Blue Cross Blue Shield of Alabama. And what they're looking at doing is providing some additional administrative services as part of that arrangement. Florida Blue will still be the contract, they'll still be the face of the plan, but what they'll be doing is they'll be outsourcing or delegating certain administrative functions, claims administration, eligibility, case management, clinical management, to Blue Cross Blue Shield of Alabama. But other than that, it's still going to be labeled and branded as a Florida Blue plan. You have a contract with Florida Blue that is in existence, is scheduled to terminate on December 31, 2020. What they are proposing as a part of this arrangement is that they will reduce your administrative fees for the 3-year period that would expire December 31 of 2021. And that administrative fee reduction is $2 per subscriber or per individual employee or retiree per month. And that actually over the 3-year period would be about an $850,000 saving to your administrative fees. So, so it's a pretty compelling proposal for consideration. And so what we'd like to do is just tell you some of the highlights of the proposal on page 3. And as we mentioned, Florida Blue will continue to have the contract. They'll be responsible for the account management oversight. The same people, Connie Ashley, the people that you see today will still be seen as this contract potentially goes into place. So it'll still be looking and feeling like the Florida Blue plan. They'll continue to be identified as Florida Blue. So the ID cards, people will get a new, every individual on the plan will get a new ID card. It's still gonna say Florida Blue on it. The only difference is that it's going to be a different customer service number. It's gonna be a call center in Alabama that will be responsible for providing that customer service support. One of the things that, that was, I think, also very appealing from a consideration standpoint is that Blue Cross Blue Shield of Alabama has quite a bit of experience with large self-funded employer groups like Polk County School Board. And specifically, they had indicated that they have a lot of school district business that they work with. We actually were invited to go up on May 29th for a site visit to Alabama, so we were able to meet the functional departments and the people that would be responsible for administering the plan, which we felt was very, very helpful to understand how they do what they do. And so we thought that that was time well spent and did not dissuade us from thinking that this was something for consideration that would be helpful for the district. Florida Blue on page 4 has also indicated that they would provide a $25,000 implementation credit to help with any transition issues that would potentially be. We don't anticipate that there will be any costs associated with making this transition to the Alabama platform. They said that that $25,000 could then be used for other purposes. If we don't use it for implementation, that $25,000 would be available to use for other considerations. There won't be any change to the network, so it would be the exact same network, the exact same discounts, all the providers and the hospitals that are currently
in the plan today will continue to be, as long as they're continuing to be with Florida Blue, will continue to be on the plan as of 1/1/2019. So one of the things that Florida Blue felt that this would be helpful for you is that they have a lot of clients that use HealthStat, which is your clinic provider. So that was one of the interface of data between Blue Cross Blue Shield of Alabama and HealthStat is much greater than what has been in place with Florida Blue. So there's already a lot of data that goes back and forth to help with that holistic, whole person approach. And as we know, the clinics are very, very important benefits for the district, and being able to coordinate care between what goes in and what goes on in the clinic and what goes on in the Florida Blue and the health plan side of it will give an enhanced opportunity to close gaps in care and to be able to be more responsive to the needs of the employees. They also have more resources on site at Alabama. So Prime Therapeutics, we changed the pharmacy benefits on January 1st of this year from Welldyne RX to Prime Therapeutics. They actually have more on-site pharmacists and more on-site resources to help, again, with that integration of medical and pharmacy to get that better view of what's going on with patient care. So that we think is another very important element of this. And probably one of the more compelling issues as well, there was a consideration of maybe looking at the Blue Cross Blue Shield of South Carolina platform. On page 5, that second bullet item is a really important aspect of the Florida Blue relationship, and that is the capitation for the laboratory services that happen in the clinics. So if you didn't have that arrangement, you would be paying about $1 million a year more in lab fees on a fee-for-service basis, but it's able to be a part of the prepaid capitation arrangement within Florida Blue. That arrangement will continue with the Alabama arrangement. It wouldn't have continued under the South Carolina arrangement, which is why that was not really a very serious consideration, even though it was an option to look at. All of the contracted services and value-added things that are in your current Florida Blue contract will continue. Things like the $100,000 annual wellness to help offset expenses to try to put out programs and motivate the well-being of your employees. We talked about the dedicated resources, the folks, Connie Ashley, Michael, Daryl, Jennifer Vendor, the folks that are already involved with the client will continue to be involved with the client. And then we would also continue to have access to the Blue Medicare Advantage program. That is also a very important element of the considerations, because you have about 1,700 Medicare eligible retirees who participate in that Blue Medicare program, so that would continue as well. So we would have very little disruption in terms of what the experience for the member would be. They'd use the same network, they have the same feel, they would have the same co-payments, the same plan design. None of that changes. That is all continuing to be the case. It doesn't impact the plan at all, other than some of those administrative functions that we talked about. So on the next page, we just have an ASO fee comparison to just give you a sense that what is being proposed, and this is the graph that says ASO fee comparison. The way that it's set up right now is you're paying $33.80 per subscriber per month, and $2 of that comes back to the district to offset the administration of benefits in the risk management department. That will continue, but that $33.80 will go down to $31.80, and you'll still get that $2. So in essence, it's $29.80 per subscriber per month. So that's probably the number that you should be thinking about when you go across and you see what some of these other public sector self-funded clients are paying for their administrative fees. And then below that, what's included? If you've got a lot of extra resources, a lot of wellness dollars, a lot of things like that, that is something that gets built into your ASO fees. And Florida Blue has done an outstanding job of partnering, I think, with the district to provide the resources to help them manage a very successful health plan. So the recommendation at this point would be to amend the current contract. As we said, it would continue to be the Florida Blue contract that's in place, but it would be amended to reflect the reduced fees and the different changes, the enhancements that we talked about with the contract, it would be extended for an additional year to 2021, as opposed to December 31 of 2020. And then with permission from the board, we would start a very intensive implementation process where we would be looking at all of the different administrative components that we would want to make sure that we are diligently reviewing for a successful transition. So that's the opportunity that has been presented for you, and we would open up for any questions.
Any questions? Ms.
I,
Sullivan?
I think it's a very good plan. Blue Cross Blue Shield has been, or Florida Blue has been an excellent company to work with, and, so I would be in favor of it.
Mr. Townsend, then back to Ms. Phillips.
Just a couple of questions. What is the school column as opposed to Polk schools?
Oh, it's just it's a school district. It's a different school district in Florida.
Oh, okay, so it could be
It's
some other
just-
county.
It's a different county.
Okay, all right. Secondly, and forgive me for asking it this way, but what is Florida Blue getting out of this?
That's why we,
You know,
because it's such a
mean,
unique opportunity in how it's going about that we wanted to make sure Florida Blue is here. So Michael Warner's here.
Sure, absolutely. We, several years ago, we actually went into a partnership with Blue Cross Blue Shield of South Carolina to help us with our large national accounts. And at the same time, we started looking at other blue plans that could help us from a backroom support. Because as we grew and as, you know, groups like yourself that became a lot more sophisticated, we partnered with another plan in Alabama that had similarities to us, but could do it a lot more efficiently than we could. So they have a lot more technology capabilities, they have a lot more build-outs that we do. For us to do the spin to try to get us to where some of these other plans are would be astronomical. So if we can outsource that, deliver the same type of network, the same type of services from an administrative standpoint, but give it a lot more enhancements from a data reporting capability, a technology capability, it's a win-win for us.
so essentially is what, there's sort of a move among the blues to concentrate back office functions in various blues that are already
For some blue
well
plans it
developed.
is, yes.
Okay, okay.
Yes. So, you know, and really we focus mainly on our larger groups for that. Our small group segment, our individual segment, we still keep that Florida Blue because most of those don't really get as ingrained with their employer groups as much as school boards like yourself do and some of our larger accounts do.
Okay, so it's more economical for you guys
Correct.
to do it with, to back office with?
Correct. Absolutely.
Okay, that's fine.
Ms. Fields?
I just wanted to know why now, but I think you answered it.
Are there any other questions?
Thank you.
Thank you.
Mr. Rowan, if you just remain there, you have budget. Is Jason joining you?
What a question, right? He's like, can I leave? I can go.
Make sure they get the color ones on file.
I'm gonna need a
Well, I have trouble with my color copier, so.
And stapler.
Yeah, and stapler, so hopefully.
too much what?
Since this was Mr. Hill's first, I cut the presentation from 28 pages down to 4.
Bless you.
Wow.
It's awful, Mr. Hill.
Good that you put it on Auburn LEs.
A little. That one goes to that page.
Thank you.
Jason, what did you spill all over this before you copied it?
He was fishing.
It was raining outside. These are actually for anybody that wants some. And I actually there should be plenty for everybody. Yeah, I'm gonna
just lead it. Jason's got a PowerPoint he wants to go through. But when we last met, we talked about, even though we were through the session and we had most of the numbers, there were some things we were waiting on and some, that would help us in terms of presenting a proposal on a balanced budget. And so some of those numbers came in and Jason's gonna go through those throughout the PowerPoint.
Yeah, I'm gonna go over this a little quick because it's a lot of it's information that we went over last time. Since the last meeting that we had, and you're probably not gonna be able to read this on the screen, but since the last meeting that we had, the fourth calculation came in. Now there's actually 5 calculations that come in through the year. The fourth calculation is based on that February student count. And so we picked up about $1.5 million through that. At our last meeting, we showed that we were gonna receive about $30 extra million through the FEFP this coming year. This slide shows 28 million because we picked up 1.5 million here in the last calculation.
So we're comparing 2 years. The previous year went up, so that 30 looks like it came down, but we didn't lose the funding.
Yeah,
We just want to make sure.
the 3 cents has still stayed in place, so that has not changed. So 3 cents on the base student allocation. And just for your benefit, the items highlighted in yellow were the newer funding categories, the mental health allocation, the additional Safe Schools allocation, which we'll be using for the Guardian program, and the $7 million in extra funding allocation. We are, I'll say that we're confident. I do not think we'll receive that money again next year, so we think that is a one-time dollar amount. So let's go ahead and move on unless anybody has any specific questions, because we spent quite a bit of time on this last time. Okay. I wanted to give you a little background on fund balance, because our district, like almost every other district in the state, have been eating fund balance. We've had more recurring expenses than we have recurring revenue. And what makes it difficult to predict fund balance has to do with what's called restricted funds and unrestricted funds. Restricted funds are basically your categoricals: transportation, SAI, reading, whatever balance is left over in those categories cannot be used towards the fund balance calculation that we're required to meet for the state. So at the top, just for your information, the items that are highlighted in a peach color, those are all restricted categories. And although those funds are sitting in the bank, we can't use them towards our fund balance. It's only the items highlighted in green that actually count towards our fund balance. But I just wanted to show you that back in 2013, we were around 7 and stayed 7 for the next year, and then we've been falling at an average of about 1% a year, and that's in line with the other districts. The bottom graph line, which is in orange, is the percentage change on a per student funding level that we received that year, and as you can see, we've been dwindling in this funding level that the state has given us. So those seem to correlate there.
Jason, if you can hold right there, even though you have
Yes.
that orange and blue up there. But if anybody would, because I know this is probably important, to make sure that we clear any questions that we may want to have on this slide when it comes to restricted. Were there any questions, Mr. Harris?
Just an observation of what you just pointed out, in an old country expression, you're eating your seed corn. You have been declining in your fund balance while your funding has decreased. So you're eating into your reserves, reducing your ability long-term to sustain the lifestyle that you've built.
That's correct. That is 100%
Something the community
correct.
needs to be fully aware of, so that they're not surprised when they see the rain buckets in the classroom.
And as I pointed out at the last meeting, we have been fortunate that we have been in a growth period. The districts around the state that have not seen growth or have stayed flat, they are having to lay off jobs to be able to meet their state required fund balance. As we grow, we've been fortunate to use that growth to kind of fund us until the next year.
Any other questions on that slide?
And I apologize, the script is so small. This is the spreadsheet that we spent so much time on at the last meeting. There's a few differences. In the old slide, under new FEFP revenue, it was 30 million. It's now 28 because we gained $1.5 million in the fourth calc, which actually goes towards our fund balance to start out the new year. I'd also like to point out about the fourth line down, federal revenue for displaced children during the 2017 natural disasters.
So that was the second piece that we talked about the last time that we didn't know. We're much more confident, obviously, that we're gonna get something in that the conference Jason and I were at last week with DOE officials. We got them alone and tried to narrow down what our number would look like, and that's the best guess we can give you right now. But it is positive.
So it'll be a one-time,
Another one.
and we believe that the 2.5 is conservative, but since the DOE could not give us better clarification, we did not want to raise that dollar amount. With our fund balance transfers, we're going to have about $845 million in the general fund to start off the year. As far as revenue, the next line, $776 million, is what our current budgeted expenditures are. So the items that you're going to see in the middle part of this page are the new possible increases that we know about. The first group of items there are operating increases that we really have no or very little control over to reduce. The second section has to do with position changes. We did have a significant amount of growth as compared to other districts during the year, and during the year we added positions to be able to handle that growth. That added $9 million on top of last year's expenses. There's a discussion about some new psychologists that will total about $500,000. And then we have looked at other areas across the district, both at the school level and district level, where we think that we can save some personnel dollars, and those are the decreases that you see there.
So we have units reduced to 50 in the schools, and I talked about this and brought this up as an option to save. This will obviously increase class size, because when you're reducing units, and we're going to do the best we can to keep is in class size, in compliance with class size, but this will flirt in some areas, and it's up for discussion, obviously, but we want to get more towards or out of the. I'd like to stop turning parents and families away when they come in and the schools are full, and so that they stay at the school that they're that they're zoned for. We move some kids and there's transportation costs that go along with that. And so, we're putting down 50 units. When I was at the conference, I want to say Hillsborough was reducing 500 or 600. And I don't know what that's going to do to them, but obviously they're larger than us, but they're in a little different situation than we are. So we have that there, and I might even say that in the following year, we may be looking at being more efficient with them also and reducing, again, not trying to make the class sizes so large that it's detrimental to both teachers and students. That's not the goal. But when you talk about 6,500 units throughout the district, 50 is what we think is reasonable.
Okay, in the next section, there's some Title I positions that were funded from Title I this current year, which can no longer be funded by Title I, and the general fund will pick up that expense, mainly out of the categorical SAI. We've seen some increases in the SAI categorical the last couple of years. At one time, we were funding quite a lot of positions out of SAI, and we've been able to shift those positions to other funding sources within the general fund. So the extra in SAI is what's going to pay for those former Title I positions. Do you want to talk about 15?
Oh, yeah, and this next number there for employee additional benefit package expense, that's for all employees. And we put in, because the board has asked for us to budget for an expense for benefits for our employees. We put 15 million down. We know we have a dire situation in our health plan that we're going to use those funds to help with that, and we're going to increase the board contribution for each employee that we have. So that'll be an increase. And we continue to work with the unions in negotiating changes to the current health plan. So we'll come back to you with how that is all going to play out, but the 15 million is there set aside for that.
And then the last little piece is the new Guardian program. We are getting about $3.2 million in additional funds from the state that have to be used to fund officers. And this is our expected cost. As you can see, it'll be about $1 million more than what the state is giving us from what we know now. Down a little further, I explained that some of the equipment that those officers will need will be funded from LCI, which is not general fund. But our new expenses for this next year is about $45.7 million. If we were to include all of these expenses, we would start with a budgeted fund balance of right at 3%, and hopefully with the anticipated lapse, we would end about 4.8. Now, at the bottom, I also included recurring revenue and recurring expense. I just wanted to point out that this budget, we are, again, using more reoccurring expenses than the revenue we're bringing in of $29 million. That's what keeps bringing down that fund balance over the past few years.
So that, when Jason and I were meeting and developing this, we were both, I guess, more pleased than what we thought the number was going to be, but then we had to kind of step back and say that $6 million there up top is from which we don't think is recurring. And we don't think we know that the federal impact, the aid there that we're going to get for the hurricane displaced students. And so we do throw caution to you that although it's, we're projecting that we're going to end this year at 4.3, and that we're going to project next year at a 0.5% higher, and that's good. But then we're worried about, I just wanna throw caution to the fact that some of the dollars to get this number looking that way are non-recurring and have recurring costs, so, there is a concern there, we just wanna,
And
and I think most of you already know that, and I'm looking at Mr. Harris, 'cause
had we not had those one-time monies, instead of a 3%, we'd be looking at 2% fund balance and a 3.8 ending fund balance.
yes,
Questions?
ma'am.
Ms. Sellers and.
I'm pleased, but we're going into a deficit of $29 million, and yet our fund balance is greater. That's still hard for me to understand when we're still eating away at our fund balance, because there's $29 million we're spending that we didn't get this year, right? Is that, even counting all the non-recurring dollars, at the end, it looks like we're spending $29 million than what we brought in, what we anticipate bringing in.
So let me just explain that recurring revenue just a little bit. It does not include the starting fund balance. So we're starting off with about 36 million in fund balance, is what we're projecting now. So that recurring revenue is just strictly the FEFP and a little bit of additional revenue that we get. So that's why it's a little confusing of it. How can it be $29 million and we're still kind of meeting our projected fund balance needs? But it's because that does not include any dollars we're starting off with. It's just purely new revenue and purely new expenses.
But I would think that that $29 million would come out of that starting revenue, because at the end, that's what I'm having a hard time. It looks like we're bringing in a certain amount of money. We're spending $29.6 million more than we're bringing in. Wouldn't that $29.6 million come out of our existing starting fund balance?
Also, what you're not seeing there in the recurring revenue is the $7 million of compression and the $2 million, the $2.5 million we think we're gonna get from the federal government for
Okay, so you could
displacement.
subtract that from the 29.
Yeah.
You're holding that separate. Okay.
And I guess my point
I didn't
was,
catch
if,
that.
if we can only use the revenue we get in this year against the expenses that we have planned, we'd be $29 million short.
Okay. Thanks.
Mr. Harris?
Well, first of all, it's disappointing that you didn't bring us a budget recommendation to keep it board policy. You're recommending violating our own policy, and that disappoints me. I have 3 recommendations. I'll first start with Title I. This board has gone on record many times over many years. When a grant expires, the positions expire. The employees are told that when they're hired, or at least they're supposed to be. You're living on soft money. When this grant goes away, your job goes away. You're asking us to absorb $7.8 million of those positions rather than eliminating those positions when the grant funds dry up. And the government has shifted Title I from the district office to the schools. I understand that. But you're acting as if there's not going to be a shift in mentality of the positions that were formerly supported by those grant dollars. And I speak from personal perspective, having worked on soft money. So that's the first thing we could do to alleviate going in the hole, is to eliminate those positions. Secondly, it looks like to me that the secondary world, it's time for us to go back to a 6-period day. That would tremendously reduce your expenditures. That's what's required in the state of Florida, is 24 credits to graduate. That would save us a lot of money. You have units reduced, but you don't have anything close to units reduced like next door neighbor Hillsborough County's doing. That's something I've advocated for a long time. This district has played, well, we won't lay anybody off, but we don't have any money to give raises. While our next door neighbor, Hillsborough County, has been doing the reverse. Large layoffs, but they give raises. Third thing, employee additional benefit package expense. that $15 million does not give the employees the opportunity to participate. It assumes that the employer is going to be the only one participating in those expenses. It's time we end that. We've been saying that for a long time. Those are 3 ways right there you could get us out of giving a budget that violates our own policy. And at some point, it looks like to me, at the end of this year that you're proposing, there will be no money in reserves that you can pull from to finance the future. You've reached the bottom of the barrel.
So if I could respond to the 3, the Title I shift to general fund, you're right, that is a cost that the grant can no longer pick up. The unfortunate, or the expense that we're talking about, however, is to our most vulnerable schools. Those are all the challenges in our students. So when we lost that, we thought it was a high enough priority to continue to fund those, so that's why we made the shift. That's 1. 2, on the 6 of 7, I think is what you're talking about in terms of scheduling. When we started talking about that, I think it was on a whole scale, probably too late in the year to get them ready for that for next year, but we definitely will put that on the table this year. And 3, we are continuing to negotiate in terms of the health plan in contributions and participation and increases in different areas and plan changes. So that is ongoing. So we will bring you a final.
I would like to add to the Title I, these are those positions, Mr. Harris, those, and Mike said those are our lower performing schools. That is support to our teachers. Those are the coaches, the academic coaching positions that we have to get us moving in the direction that we're going. We have been having conversations about 6-period day and, looking at our schedule. And he's right, when we started those conversations, it was late. Most schools had built schedules. A lot of them had. So those conversations about scheduling is occurring. We've been having those conversations. Mr. Townsend?
Yeah, just sort of follow up on that. I don't know if I understood Tim correctly. He said it's your understanding that the employees aren't going to get anything in the health plan, because that's just false. I mean, my understanding is they're going to get a lot. And maybe I misunderstood what you said. You could clarify that. We talked about this at the last board meeting. I think we agreed to look at both class size stuff and 6 days, things, longer term solutions like that. There's going to be an election that's going to change this board. It's also going to change the governor. It's going to change the legislature. Probably going to change the funding. This is actually pretty good news. Our holding year has actually gotten a little better. And it gives us time, buys us little time to think ahead and know what we're going to be dealing with. So I appreciate you guys. There's just a lot that's uncertain, and I can tell you this: anything above a 4% fund balance, I don't really. We can fight over the policy all we want. We violated it last year. We'll violate it again. That's recurring. Anything that's in the fund balance is recurring. We either recur it doing nothing, waiting to be stolen by Tallahassee, or we put it in our people's hands. I will put it in our people's hands 7 days a week and twice on Sunday, and no apologies about that. And we'll debate you anytime, any place about it. So that's kind of what I want to say about that. Sorry.
Ms. Fields?
Can you all explain a little bit about the reorganization of school district resources, $500,000? Is it looking at all of the departments, or where did you guys come up with that figure?
It's kind of a combination of both. There's going to be a staffing plan on the district that you'll be receiving that'll have additional, reductions on that. We're still working that through. We'll get that at the end of July. This is some the air bases that I don't know what we fully disclosed. So
lease, for
so
the-
the air-based
the
lease is in there and certain things of that nature.
So at what point in time are we gonna start looking at, the need to make some tough decisions on discontinuing, programs or stuff like that? I mean, we can't keep digging a hole. And I know we have really tried not to lay anybody off, and that's been one of the goals, I think, of the board and the superintendent. But I guess I'm just concerned, how much more can we cut? And, and be able to do the quality of education that our kids deserve, if that makes any sense.
That's getting more and more difficult because we continue to do it and the revenue's not there, so it becomes a grind every year to figure out what we're gonna do.
So I'm sure you all are looking at all of that.
Just a comment, just want to say thank you. I didn't anticipate walking in here and seeing those numbers. While they're not ideal, they're a whole lot better than how I felt at our last discussion. And I think we just need to keep on. I understand some of those values are one time, like the disaster recovery and some of those things, but I just think that we were blessed to even receive that, considering we opened our arms and didn't look twice, just took care of what we had to take care of and took care of kids. So I think that was great. So yeah, what the future holds, none of us know. But looking at this now, I think y'all have done a great job. I'll be just very curious to see how the health plan piece, and I understand that's still being negotiated, comes out. Because we may not have to infuse that full 15 million. I don't know, based on what comes out of some of that. So to me, that's kind of question mark, really. I mean, that's a nice lump sum to say we'll throw it in there, but we may not have to use all of that. Again, I'm not privy to all the numbers you've looked at, nor what's going on around the table. So perhaps we won't be, whatever, perhaps we'll be at least good for this coming up year. And then we'll see where we go from there based on what the legislature does and what kind of funding we get and all of that. So to me, I know we're looking long-term, but at the same time, you gotta deal with today. And I think you've done that, and you've done a commendable job considering where I thought we were gonna be, very different. So thank you, because I know it takes a lot of time and effort on everybody's part to come up with this, so thanks.
And just one more slide. This, and I know Angela Usher will be talking about this additionally too. Just wanted to point out, because for as much as the general fund keeps me up at night, the capital funds keep me up longer.
As we can tell from the timing of your email.
Sorry for that, Wes.
It's okay, Tommy.
The green, what I want to point out is the green that's in that graph, that's our sales tax. That will be up for referendum, the renewal in November. And that represents about half of our capital funds. We are receiving in the neighborhood of about $100 million between sales tax, LCI, and impact fees. And just to build a high school, you know, that's in the neighborhood of $70 to $80 million. So I just wanted, I know that it's on the forefront of everyone's minds, but I just wanted to give you a little graphical representation of our capital funding.
That is a great graph.
You
It
like
really
that
is.
one?
That is a
Very
great graph.
visual. Mhm.
I mean, you look at it and bam.
Thank you. I will take that compliment.
No, you should. That hits you right between the eyes how important that sales tax is.
Mhm.
That is a great graph.
Yeah, thank you.
Thank you, guys.
Right, any more?
Next up on the agenda, I don't think we have no right now. We have Mr. Davis is gonna give us an update on the transportation operations training that's been ongoing. We told the board that we would bring back information regarding the training of staff, and I think Mr. Belcher is going to join Mr. Davis. Vision are also the ones who is our first line of contact when it comes to the emergency operations for any hurricane. They basically spend all night at the EOC building,
Yes, ma'am.
besides the rest of the team.
Yes, we have a good team.
A little scary in there,
School
kind
administrative staff.
If the truth be known, right?
I can tell you, while we're passing these out real quick, I've been doing it since 2000 with, I started out with Mr. Brett Murphy, and then,
Thank you, sir.
I guess in 2012, became a liaison, and to my knowledge, we never had a superintendent or a deputy superintendent attend the EOC during a hurricane. And Mrs. Bird and Mr. Small both did at all hours of the day and night during hurricane. So I just wanted to give them that accolade because we haven't seen that before. Mr. Belcher is handing out, hopefully I can get to this slideshow. Okay. Thank you. I appreciate that. I have to say that this presentation has been a difficult one to prepare due to the tragedy that happened on a school bus and events that led up to that day. So this has not been one of the easier ones to develop, but what I think we'll show today is what we've done in the past, what we're doing presently, and what we plan to do in the future. And in the past, we've always done basic first aid and CPR training, and it was given to all school bus drivers and attendants using the DOE training curriculum. Not curriculum that we did, but the actual DOE curriculum that all 67 counties used. So, also in the past, we certified first aid and CPR training, which was conducted through Ridge Technical Center. And unfortunately, the funding for that program was eliminated. And I believe it was due to the FTE dollars for the drivers and attendants going through the first aid and CPR. And so that actually was discontinued, and we went back to the basic training that's in the curriculum. We did a mega district, and a mega district is any school district that has 400 plus buses on a road servicing students daily. So we are one of those 9 districts that fall into that category. And out of all of the 9, there was one county that required certified first aid and CPR. The rest of the mega districts were doing the same thing we're doing presently, which is the basic CPR and first aid training through the curriculum. And that happens to be Palm Beach County that is doing the certified first aid and CPR. Okay, present drivers and attendant training. Drivers and attendants are required to go through 40 hours of classroom training. And during that 40 hours, they go through a first aid and CPR section, which is chapter 10 and the curriculum. And that is before they are hired and are put on a school bus. And that doesn't include the CDL training that is on top of that. So they spend 40 hours in the classroom, and then at least 8 hours on the road, and sometimes more than that. We also provide, it's also mandated that they have at least 8 hours worth of in-service each year. We provide annually 12 hours of in-service training, and in most years, more than 12 hours of training, which we cover first aid and CPR in those trainings at some point during the year. In slide 6, Mr. Belcher will talk about the present training and equipment that we're currently doing and the equipment that are on the school buses.
Okay. Yes, the current training that we have, first aid, there is a video and a lecture with that. CPR, another video and lecture. Child abuse, passenger management, bloodborne pathogens, recognizing an emergency, de-escalation and ESC training for all our drivers and attendants. Currently, as far as bus equipment is concerned, first aid, there's a first aid kit on the bus. We did add in, it was the 16-17 year, an ice pack kit, which also includes aluminized thermal blankets. We wanted to make sure that those students that couldn't control their body temperature on our ESC buses, we had that in case there was an issue with air conditioning, or so we did add that year. We had body fluid cleanup kits, and of course wheelchair tie down, safety vests, the wheelchair lift, of course, and oxygen bottle containers for those students that may require oxygen. We have a place to put those. We also have the emergency quick guide, and that was, I think, put in place in 2012 to where those are on every bus. That's something that, and you have a copy of that with your packet. That's something that the drivers can use very quickly if they do have an emergency, and we go over that also in training. Okay. Next slide. All right, last year, or before this year, we decided we wanted to have more training with our center school drivers and attendants. So what we did, we got with the union, we signed an MOU or a memorandum of understanding with the union, and we set up a committee to decide what type of training requirements that we needed, and we started that this past year. That is a total of around 6 hours of training in class, and then we have the, let me go through some of these. Behavioral intervention, first aid, CPR, special needs equipment, student behaviors and emergency records, additional dexterity testing, and collaboration training with the school staff. So those are the things we decided that we needed to, areas we decided we needed to train in, and that's what we've been doing since the second semester of this past year. We provided that training to all our center school bus drivers and attendants.
The following slide is the additional steps taken to assist employees on how to respond to an emergency. And before the collaboration training and the MOU that was signed through the union and Mr. Belcher's negotiation team, we did center-to-center training when coordinated and when student-specific training was needed. And that went all the way back to 2002. ESC transportation registration forms, which is a loan form. You'll see in your packet a yellow information card, and then you'll see, I think it's a tan. I'm colorblind, so forgive me if it's not tan, but it looks tan to me. And that is a what we call an ESC loan form, and it gives the parents the opportunity to provide the driver and attendant any instructions or any issues that a child with special needs may have. It also states that they can be left home alone or not, and so so that information is pertinent to have on the school bus. We also created the emergency quick guide, and that was established in 2012. That was a collaboration with our ESC department, Mark Wilcox, our nursing department, the Polk County Health Department, transportation staff members, and that is what you see in front of you that has the numerous basically incidents that you can flip to, and it tells you what steps to take and what steps to follow. We also created the school emergency plan for bus drivers, for bus transportation in 2012. That's also in your packet. That gives in-depth information, and that happens through a IEP team. And if it's decided that there are signs that if a child is having a seizure, these are the signs that take place, and then this is what you need to do. And so there are examples. There's examples of what to do if the child is having a insulin reaction, what to do if they are allergic to a bee sting. And so those health plans we have on our school bus, in our dispatch office, in our area manager's office, and at the school site. So that information is also pertinent on how to deal with a student when they have a crisis situation. And then, of course, in there, most of it says call 911, and we stress that the drivers and attendants call 911. It doesn't cost anything. Actually, you can have a cell phone that powers up and doesn't have a plan and still are able to call 911. And so if they do not have a cell phone, that's when we instruct them to call our dispatcher, and our dispatcher will then call 911. But if they have the cell phone, it's better for them to talk to the dispatcher at the EEC center and not be relayed through our dispatcher. And Mr. Belcher will talk about the additional dexterity testing.
And I mentioned that earlier, additional dexterity testing, we did add that also to our annual training that we're providing with our, for our center school bus drivers and attendants. That's just an extra timed test. We basically have them remove wheelchair from securement, they'll roll it onto the lift and they'll manually lower the lift and manually raise the lift so that we know that they can do that in cases of emergency, because there are times where, you know, we may have a breakdown somewhere and we need to get a child off the bus that may be in a wheelchair, so that's part of it. We also have them lift the wheelchair up from laying down on its side, and also attach the wheelchair to make sure that they can do that correctly and in a quick manner. So, okay. The next thing is collaboration school training. That is something that's very important. We are requiring that 2 hours each semester. That's something where they do talk about collaboration, or they collaborate with the school staff to determine what the needs of some of the students that go there may require. We talk about emergency plans. There's several different issues that they may talk about that the school thinks they may need to know. So that is a very important part of it. So I just wanted to at least kind of give you an overview of what that is, and it's mainly talking student-specific issues with students at the school. All right. In the future, we're looking at hands-only CPR training. That's basically dealing just with the compressions. And that's a program that was, I guess, started by the American Heart Association. That's what we plan to do in the future. We want to provide that hands-only training to all of our drivers and attendants and staff on an annual basis. We plan on doing that during our first in-service before we start school. So that's in the works. First, we're going to still provide first aid review, behavior interventions, and we'll continue with our collaboration training for individual student needs.
Also, the hands-on, that is the kit. There are 10 hands-on, only, for lack of a better term, mannequins. It also comes with video instruction and the actual use of AEDs and how you could use that if we were able to put those on school buses. We need 18 kits to do all of our drivers and attendants, and we are currently working on trying to secure that funding. They're about $695 for a kit, and it comes out to about $12,500. This is what's in progress. This was actually a training that was done at our transportation department, and that was an instructor that actually gave the training. Again, this was some one-on-one demonstrations, and in the back there's the DVR video. This is a sample of the emergency quick guide that is under review, and we'll make some changes, and that will go out at the beginning of the year, so there's no question. Go ahead.
Now, is that going to every bus, or is that going to every bus will have one of these on it?
Yes, sir. Everyone. And we're looking at going to something like this, which you can change out the inserts without having to change the entire manual. And in closing, our goal is to provide hands-on CPR for all drivers and attendants before the start of the school year 2018 and 19. With all of our training, we want to do everything we can possible to ensure a child's safety. And if there's any questions, we'll be happy to take them. Yes, ma'am.
I never thought about this until the accident that we had this year, the tragic accident, but some of our ESE are so medically fragile, and I never thought about the fact that we're transporting them on a bus. And this is an example that happened to my son, and this is how critical this care is. He had a trach, and he was in ICU, but they ran out of space, so they threw him on another floor. His trach got clogged, and he's in a hospital, and there's no one on the floor that knows how to unclog the trach. Luckily, they got somebody in time from ICU to come up. So I'm thinking there's a floor full of nurses that can't unclog a trach. That's very specific. And maybe you need equipment to do that with. Have we thought that deeply of looking at these ESE kids that have very specific medical things going on? And because I'm thinking some buses may need a RN or a licensed practical LPN.
And in those cases, they do have a nurse usually riding with them. There are times where we do student-specific training if there's special equipment they have, and they will give the instructions to the driver and attendant to make sure that they know how to deal with that specific student. But in most cases, in situations like that, the nurse is on the bus.
Okay, so we do have nurses traveling with some of our
Yes.
medically fragile.
Ms. Fields?
Mr. Davis, you said something about some of the buses don't have cell phones or don't have access to 911. What are we doing to rectify that?
Well, one, we have a two-way radio communication which can call our dispatcher, and they can call 911. We talked earlier today, and like I said, you can power, if a cell phone powers up, there's the ability to call 911. And so that's something that we can look at. If they do not have a phone, that's something that we can look at providing them. It doesn't have a service plan, doesn't cost the district any money. It just it has to be charged and operational.
Well, I know that you guys have a lot to try to figure through, but I think that's critical.
Yes.
I think there's just no excuse for someone to get on the bus without having access.
Mr. Towns, and then back to Mr. Harris.
Yeah, just to add that I think the public would be shocked to hear that there is not a district-provided mechanism for a bus driver to call 911. I mean, it's a little shocking for me to hear it, honestly. I wanted to focus on that first. Secondly, I think this would have been helpful discussion to have when the parents came to visit us last month at the meeting. And I think you were somewhat prepared to talk about that. And I think that kind of dovetails into something I feel like I need to say publicly, which is that I disagree with Wes's advice that he gave us. For the public, Wes says that we should not embrace the parents and should not talk to them, involve them in reforms that we make because they may sue us. Let me be very clear. This child died horribly on one of our buses while our people watched. I would sue Wes too. I think, tell me if I understand liability wrong, but we're capped at $250,000, right? That's unless there's a claims bill?
Unless there is a claims bill.
Correct.
It would actually be $300,000 for that.
Okay, well, I think we should have already written that check. Secondly, the way a claims bill happens, it goes to the legislature and it becomes a political issue. The legislature votes on it. And one of the things that I think stories tend to get told is if there's institutional callousness, if there's a treatment that is cold and unhelpful. I don't want this family to be able to tell that story just for the sake of right and wrong, but from a purely mercenary money point of view, it's foolish not to embrace them. On top of that, it's incredibly immoral. They've been very constructive, especially the mother, who I've talked to multiple times. And I just can't disagree with that advice more. And I think it goes to some of the institutional problems we have as a whole here, where cheap liability is more important than morality. And I'm going to be talking about those in a few minutes, but this is, I think, something for everybody needs to think about and the whole public needs to hear.
Mr. Harris?
On slide 8, where you talk about the additional steps to be taken, the additional dexterity testing, I assume that is going to be now something that you look at in terms of employees being fit for duty.
Yes.
And in terms of also future employees that you bring on board, because that adds a different dimension to the physical capabilities to do the job.
Yes, sir. In the past, routes were assigned to the most senior person, and we have changed that now. They have to be physically fit to do those types of requirements that a special needs bus would have. So the seniority piece is out of that picture now, and we're looking at strictly employees that can do that physically and handle the situation.
So those that would not be fit for duty for a special needs bus might have employment opportunity elsewhere?
Yes.
Thank
Any other questions?
I just had one comment. I know Dr. Riggs is looking in his email, but we had at Central Florida School Board Coalition several months ago a gentleman that came to speak to us about having these kits donated. So I don't know if that's what you're looking into when you said you were looking into the funding, but if I can find his contact information, I'll forward it to you.
We actually received a letter from him, and we
Okay.
worked with Dr. Hutek's staff. I think her name was Lisa. Anyway, we've worked with Dr. Hutek's staff. There is a chance that there are some donations that could be given to us. But if no donations were, I was just giving you the
What it would cost.
raw numbers, what it would take. It'd take 18 kits, and they're $6.95 a piece. But yes, I do have a letter that was sent to the superintendent. She
Okay.
gave me back in April. We've had conversations, and we've actually received another correspondence. He is also looking at trying to provide district-wide CPR training for all students as well. So.
Any other questions? Okay, thank you guys. Next we have Mr. Butler with the Code of Conduct.
Just in case you didn't have a cheat sheet open.
Thank you, sir.
And there we go. All right, good afternoon. How are you all today?
Good afternoon.
Good. All right, I'll go over the changes. You can ask questions after each one. You can ask questions at the end. It's totally up to you. I've grouped some of them together, being conscious of time. I will tell you that Rachel's department did redesign the front cover to where it has the new school logo on it, so that is one of the changes that I didn't mention. But if you'll go by your sheet that I've given you, I've given change numbers. On change number 1, all we did was take the table of contents and reword it to add the school messenger opt-in form and searches in the table of contents. Changes 2, 3, 4, and 5 under school students and parents working together, we reworded bulleted points. We added teaching self-advocacy, added engagement strategies, and multiple levels of support to mirror PBIS language. For number 6 and 7, we added language to prohibit trench coats being worn at school and no hoods to be worn during school hours as a safety measure. On change 8, student ID badges were added to the code, requiring all students in the grades of 6 through 12 to have one on and be worn around the neck as a safety measure. On change number 9, we reiterated trench coats are not acceptable attire under our outer garment section. Number 10, change number 10, we mirrored from the glossary the definition of searches and placed it in the body of the code with the additional language to include, any search will be conducted in accordance with School Board Policy 5771. In the event this policy is updated, we would be in compliance at that time still. Changes 11 and 12, we added a paragraph that says schools will provide a continuum of support to address the problem. These interventions are systemically applied, match the problem, and have sufficient intensity to address the need. This was done to mirror PBIS language. So now the next section, changes 13, 14, 15, 17, 18, 19, 23, 24, and 25 are all the same. They all had, we added a statement that says violations of this section may be referred to mental health services identified by the school district pursuant to statute 1012.584 subparagraph 4. This is being done because of the Marjorie Stoneman Douglas High School Public Safety Act. It specifies in statutes that students that are violent or disruptive may be, and I wrote it, may be referred to mental health services pursuant to the statute or an alternative program. It goes on to say that students will be referred if it involves a firearm, weapon, or explosive. Items 16, 21, and 22 refers to the firearms, weapons, and explosive devices that require that students in violating of bringing a weapon or firearm to a school be expelled for a period of not less than a school year, which we currently do, and will be referred to mental health services pursuant to the statute. Therefore, the language is added to these sections to read, violations of this section will be referred to mental health services identified by the district. Mr. Maxwell's team is working on the directions and referral forms for the students referred to those services based on the findings by the initial threat assessment team at each school. They're also working on the criteria for when a non-mandatory violation of the code warrants referral under the statute, and a process for those that are mandated to be referred under statute. That information will be shared at the beginning of the year with the administrators. Those are the changes that I have. Any questions?
Ms. Fields?
I have a question on the makeup of the committee. How do you select who serves on the Code of Conduct Committee?
Well, we send out an invitation at the beginning of several years ago, and then as one drops off or says they cannot participate, then they're replaced with like, whether it's an assistant principal, a principal, dean, whatever.
I have an assistant principal who's interested.
Just send me their name.
Okay.
And I put them on a list, and then as people drop off, I go back to that list.
Okay, thank you.
Ms. Cunningham?
Just a comment. I know we received an email recently regarding the district's policy for backpacks. And I just think it needs to be noted that there are no specific backpacks that are going to be requested for the beginning of the school year, that regular backpacks are allowed as well as lunch boxes. Am I correct?
You are correct. There is nothing in the code.
Nothing in the code that specifies. Okay, just want to be sure. I've gotten a lot of calls.
Clarification, but an individual school can make additional rules, can they not, about no backpacks?
They should not be making them overruling the district's policy.
Okay, I mean,
They would have difficulty enforcing them.
Yes.
Right.
okay, okay.
Okay. Any other questions?
I just one other thing. What about the enforcement of hooded sweatshirts? That is just, when I'm on school campuses, sometimes I see that. It's not like all the students, but it just seems to be a habit. And so how do we address that? I know it might not appear to be much, but it just seems to me like if we have it here that it's not acceptable, and we need to do what we should to.
That would fall under the dress code when it comes to disciplinary actions for there. And part of the reason for the hooded sweatshirt, or any type of hood being worn, it becomes a safety issue when the students are walking through the hallways. We need to be able to identify the student or whomever it may be, and that's one of the reasons why, because hats are already on there. So we want to make sure that that's why it will be an enforcement.
The reason why, I'm just saying that it's an issue.
Yes.
It really needs to be addressed.
And that's why it was put in this year, and we've been talking with the schools already at the end of the year administrative meeting, that was announced, and we will be going over it again at the administrative AP and Dean meeting also.
Which one?
And I just wanna clarify, it does say they still can wear the hooded sweatshirts, they just can't wear
Correct.
the hood. So if it's freezing out and they have a hooded
Yes.
sweatshirt on, there's
That's
a
why
way
it
to be told
says
to
it
take the
is
hood off.
acceptable, but
Okay.
hoods may not be worn during school hours.
Inside the building.
Any other questions? Okay, thank you much. Next we have Wendy Dodge, who has a few policy updates, some staff and some Neola. So she will come before us.
Good afternoon.
Afternoon.
I'm looking forward to this. Before you today, we have 3 policy updates. The first is recommended by staff, and that is a codification of our current practice where we've increased the number of vacation hours that employees can roll over at the end of the year. And that's from 320 to 480. And then the final 2 were recommended by Neola. The first is our federal grants procurement policy, where they've just added language to align with federal requirements regarding minority outreach efforts. And then the school nutrition program, which is again to align with the bad debt requirements from the USDA.
Is there any questions?
I think that's good on vacation leave.
Yeah,
We're
awesome.
okay with that one, that's good.
Anything else?
Thank
Well, thank you. Have a lovely afternoon.
Thank you. And last, before we have executive session, we have the Florida, our equity annual update report.
Good afternoon, everyone.
Afternoon.
So it's that time of year again that we have to submit our equity report to the Florida Department of Education. You all have received a copy of the report already. I just want to highlight some things. On page 5, thankfully what the Florida Department of Education does, they review everything for us. Essentially, they only found that we have one item that we need to add, and that's the statement on page 5. The district should add the statement that the lack of English language skills will not be a barrier to admission and participation in CTE programs to its career and technical program publication and website. As required by vocational guidelines. Please submit the link to OEO by March 15th, 2018. So we've done that, but that was the only thing that we've had to add this year. If we go through everything, essentially the equity report is divided into 3 sections. So we look at advanced placement in terms of classes for students. We also look at athletics, equity in athletics, and we also look at equity in hiring practices and employment. So the first part is equity in education. If we look at pages 7 through 8, for grades 9 through 12, advanced placement, that includes advanced placement classes, IB classes, and Cambridge classes. That's what ACE stands for. Essentially, of those, we have had a overall decrease in students from the years of our baseline years 2013-14 to currently. So it reviews a 5-year span. And if you look at that, whites in that program, they're down 1%. White males down, it's the same percentage, but it's down by 105 students. Blacks in, again, advanced placement, IB or ACE, they're down 2%. And then black males are down 1%. However, Hispanics, we have increased our Hispanic population. We've increased the number of Hispanics in ACE, IB, or advanced placement classes. And even though the percentage is down by 2, it has increased 255 more students. And I think it just overall accounts for, the percentage being lower accounts for the larger increase of our overall student population. Again, if you look at the Hispanic males, we're down 3%, but we have 50 more students in those classes compared to our 2013-14 baseline, and then an increase in 1% of our ELL population, and that's up 12, and we don't have data going back to 2013-14, only from 2016-17. Do we have any questions there? No? Okay, so if we look at pages 12 and 13, again, kind of going through the same thing, dual enrollment, there's an overall increase in everything. So whites increase, dual enrollment classes, an increase of 2 percentage points from the baseline year of 13-14. White males increased a 2%. Blacks have increased 1%, and black males are the same, but there are 18 more students there. Hispanics, an overall increase of 1%. Hispanic males, it's the same percentage points, but an increase of 64 more students. However, if you notice, our ELL population has decreased by 1/4 percentage points, and that is 6 students from the 16-17 school year. If we also look at all level 3 courses and above, so this includes AP, IB, ACE, dual enrollment, and honors courses, and that starts on page 16 and 17. If we look at that, the whites increased 3%, white males increased 8% overall, increase in blacks by 6%, an increase in black males by 9%. Again, increase in Hispanics in all level 3 courses by 4%, and Hispanic males by 7%. There was another increase of about 5 percentage points in ELL students. I will not read the numerous gender equity and athletic reports there, but if you'd like to read them, you're more than welcome to. I encourage you to look at those. However, the majority of them, in looking at the data, the majority of it does show that we try to be as equal as possible in those athletic programs. I'd also like to call your attention to page 37 of the report. It's our employment and equity. And so it has a lot of numbers there. What I did is I compared it to 16-17 as well. So overall, there is an increase of student demographics. Last year we were at 102,280 students. This year we're at 104,449 students. So it's an increase. This is all data from the Department of Education, so this is what they provide us based on Genesis and everything. But it's an increase of 2,169 students overall. We have a decrease this year of black students. It's down by 1 percentage point. We have an increase of Hispanic students. That's up by 3 percentage points. And we have a decrease in white students, and that's down by 1 percentage point. In terms of district level administrators, from last year we were at 87. This year we're at 91. And in terms of percentage points, same thing. We have a percentage point of 1% increase for black administrators, district level administrators, 2% Hispanic district level administrators, 2 percentage points of whites, and then a decrease of a 1 percentage point for others. Females and males, we are down by 2 percentage points from last year, so that's from the 16-17 school year. Principals, we have 142. Last year we had 143, so that's a -1. But in terms of percentage points for blacks, we are up 1 percentage point to 23. We did also increase our principals, and those that by 2 percentage points. We also increased our white principals by 2 percentage points, and others remain the same. Also with male and female, it's a -1 for female, so -1% for female, and then a positive 1% increase for males. Assistant principals, we have increased from 221, that was our base number last year, to 223. And in terms of blacks, we are a -1% decrease, and then Hispanics, we increased by 1%. White assistant principals remain the same, and other assistant principals remain the same. We are down in both female and male assistant principals. Regarding teachers, we have increased our teacher count. You heard Mr. Perron talk about our increase of funding or increase of units because of the increase of students. So last year we had 6,737 teachers. This year, we have 6,773 teachers. And so that increase is about 36 teachers. I thought it was more, but it's about 36 teachers. And overall, we have 828 of those teachers, that's about 12%, that's of blacks, and that was the same from last year. 783 Hispanic teachers, and that's an increase of 1 percentage point from last year. We have 4,983 white teachers, and that is the same from last year with 74%. And other teachers, 179, which is 2%, and that's down from last year from 180. The male to female ratio stayed the same and did not change between from last year to this year. And finally, guidance counselors. This year we have had an increase in number of guidance counselors. We are up from 215 to now 227. That is a positive 12%. I'm sorry, positive 12 guidance counselors, not percentage. In terms of the numbers and the actual ratios, the blacks guidance counselors, we have dipped. So last year we had 26%, this year we're at 25%, so we're down 1 percentage point. Hispanic guidance counselors, we are up 3 percentage points. White guidance counselors, we are down 2 percentage points, and then others remain the same. In the female category of guidance counselors, we have slipped 3 percentage points to 86%, and then in the male categories, we have increased 3 percentage points to 14%. Do you have any questions? I know that was quick, it was a lot of data, I'm sorry.
Mr. Townsend, and then Mr. Harris.
Two. How long before we project that will be a plurality Hispanic district? I mean, we're very close to that being the largest portion of population now. Do we have any, that next 3 or 4 years? Or if we don't have that, it's fine, but.
Yeah, that's not something that I could predict right now.
Secondly, I mean, I think it's, if you look at the population of Hispanic kids, there's 36% of our population.
Mm-hmm.
And then you look at our district level administrators, you look at our principals, you look at our assistant principals. It looks like the biggest dislocation we have in this is Hispanic administrators compared to Hispanic kids. I think it's important that we develop and take care of those types of administrators. I would love to know what we're doing to drive that, how we're developing them. We don't have to talk about that today, but in the future, I would like to hear that.
It's something that I'm really looking at, just overall, I can kind of answer your question. It's something that I'm really looking at to try to dive into the data to figure out, one, when we're recruiting a lot of our teachers, a lot of those Hispanic teachers just don't want to come to Polk County. Quite frankly, Polk County has a very black or white reputation, and so it's very hard to recruit Hispanic or minority teachers, and so trying to recruit them is just an issue. I think once we get them in our schools, then we can start building on the teacher leadership piece and then that pipeline into administration.
Mr. Harris, then Mr. Reynolds.
Looking at your number of guidance counselors, and I have 2 issues I want to bring up. We have 227 total that is showing for the 17-18 school year.
Yes, sir.
How many actual school sites do we have? And how many schools do we have without a guidance counselor? Because at only 227 and all of our secondary schools have multiple guidance counselors, it seems like to me we're going to end up with a lot of schools with no guidance counselors if at only 227 guidance counselors.
Well, I can take a look at that. I think the majority of our guidance counselors, you're correct, are at our secondary levels. They normally do have 2 to 4, depending on the size of the school. All of our schools, from what I understand, at least have 1 guidance counselor.
What I thought.
Mm-hmm.
So if that's 130?
About, yes.
Then that leaves less than 100 to spread among all the secondary schools who have as much as 5.
Correct.
That seemed like a stretch. When the, I think the ratio is supposed to be 1 guidance counselor to every 225 students according to the federal recommendation.
Well,
we're not anywhere close to that, but that's what the federal recommendation is. and we're closer to 1 to 500. Just an observation. The other observation, I looked through here and I could not find, there were many, many pages by school of the gender equity in athletics. But being an equity report, I couldn't find the racial equity in athletics reports. Every school is listed as a gender equity, but no racial equity reports in athletics. Everywhere else, but not in athletics. I just wondered if I'm missing.
Isn't that because everything's done through Title IX? Like it's
Yeah.
primarily
That's not something that
gender,
we
it's a
normally-
gender-based, the equity measures are
Right,
gender-based.
that's not something that we
Oh.
normally report, but Dan.
We've never done athletics by our race.
But everything else in this report, is my point, is broken down by all the breakdowns, including racial, except this one glaring omission, which I think it ought to be added simply because all the others are there, all the other things that you're measuring include all of them.
So what happens in terms of completing this report, Florida GOE provides the template for us, and they provide the actual data that they'd like for us to complete. And so, because the race was not provided in the athletics report, it was not something that we would automatically just add to it at all.
So we would have to add it because of self-interest in the community, not because they provide it in a template,
Correct.
which might be something of interest for the community.
Okay.
This is a federal compliance document, right?
Yes, it's a Florida DOE compliance document. Yes, ma'am.
I was just curious, and this may be a silly question, but when it has the breakdown for the grades 9 to 12 for
What page are
AB,
you?
all of those on page 5, I think is where it starts.
Okay.
They break out the males in each section, but they don't break out the females. Is that
Kind of one of those same
Okay.
answer for Mr. that I just stated
but
to Mr.
DOE
Harris.
makes us break out males, but they don't make us
Exactly.
break out the females.
Correct.
Okay.
Because you're gonna assume.
No logic, no.
I mean, that would be something that I would be very interested in seeing, just in future reports, not
Okay. What I could
necessarily
do
this year.
is make a revised report, maybe just for the board members in terms of the additional items that you've asked for.
Any other questions? Okay, thank you.
Thank you.
We have executive session at 3. So at this time, we would like to break and probably start at, we're at 3:05 right now. Start executive session at 3:10, Mr. Bridges. And we will do it in this room.
Yes, we will clear the room for this. The only people that will be present will be the superintendent, the board, and the finance team making the presentation.
Okay, we're reconvening. We have information items. Are there any questions? I know you see the community eligibility item that's out there, the CEP. I just wanted to see if there are any questions on any of them. And if there's anything on that one, Jenna is here.
Just a quick comment on that.
Yes.
That was really useful, whoever put that together. Thank you. That's about as, a lot of light bulbs went off for me on how that works because of that. So I really appreciate it. Thank you.
It's great.
Okay, if there are
Thank you.
no other comments, Madam Chair, I will now turn the meeting back over to you.
Thank you, Madam Superintendent. At this time, we'd like to do our board agenda review. So I'm going to basically do it by sections, and then if anyone has any questions, please let me know. Let's start off with items basically C1 through the consent agenda, which would be C10. Any questions?
Like, you doing through the whole of the consent agenda, or just through
No,
C2?
I'm doing C1 through
Okay.
C10.
I'll wait.
Anyone? You do? Ms.
I
Sellers?
I just want to say, I think the Pope Pride Proclamation, it caused a lot of issues. It's more divisive than it is bringing people together. I support our kids. If you know my heart, I know we do this with the, of supporting our kids. We support our kids. I value every kid. I would fight to the death for any kid. But this is the only proclamation we've ever done, who upsets many people. And I really think the proclamation itself, if we wanted to do a proclamation, we should do it supporting all of our kids. It's a diverse community, and we may end up getting a lot of proclamations we don't want to, and they'll say the same thing. We've got diverse kids, and we want to proclaim we can support our kids without supporting every group orientation that they belong to, because I do believe in valuing and supporting our kids and protecting them and providing a welcoming and safe. But this is causing more division than it is unity. So, and we did it last year, and we had a lot of issues with it.
What's,
I
any other
concur,
comments?
I concur and have spoken to the chair and told him directly in no uncertain terms, I object to this being placed on the agenda for the same reasons Hazel represented.
Anyone else?
No one's required to vote for it, right?
Excuse me?
We avoided the vote, right? So there's.
Yes, sir. It'll
It
just be
just
read.
implies consent by the fact it's being read.
Well, you can certainly speak up and say you don't want anything to do with it. I had exactly zero input from the proclamation last year, one way or the other. And I'm pretty pretty communicative dude. People are generally not shy about sharing their thoughts with me. So I'm not really sure what great disruption you felt. I didn't feel any. I will happily read the proclamation today. If anybody's got a problem with that, then I guess you just speak up at the meeting. From my point of view.
Anyone else? And I think since it's been placed on the agenda and it was discussed at our last work session, I sort of feel that we just need to move on. Basically, I've read the proclamation, and the information in there basically just says that we're gonna treat all children equitably. Doesn't give favor, doesn't give anything, so I'm okay with it. If that's what the board decides to do, I think we've decided that at the last meeting when we talked about it, when it was on our work session.
Did we talk about it?
We didn't,
Did
we
we?
was not on our work session.
We set a new policy in which these things wouldn't be voted. Oh no, that was not my policy, but it was going to be handled by the superintendent and the chair. They handled it.
They handled it.
It's been dealt with. That was the policy everybody seemed to want. I can go either way. I'm fully prepared to have a vote if necessary. But this is what we talked about.
I just don't think you take something like that off an agenda after it's been on there and it's been out in the public for however many days. I just think we move on.
There's
And
no,
if you
there's
have,
nothing attached. There's no proclamation.
Is that a proclamation?
No.
I
That's funny.
received
I have
one.
one.
Yeah, I received one.
They gave me one when I walked in the door today. So whatever.
What's the pleasure? Okay, then let's continue. Let's go through our consent agenda. Basically, items C11 through C18. Any questions? All right, let's look at items C19 through C26. Now let's look to item C27, which is all the donations, through C59. Let's look at items C60 through C68.
I've got
Yes, sir.
C66 through C70. I want all of those pulled and put on the regular agenda. I think it's important to illustrate to the public that the board is asked to vote on personnel issues, on administrative recommendations for administrative transfers and actions. I'm completely unsatisfied with how we handle those. I'm going to vote against all of these, and I want the world to understand that we've been voting for all of these on the consent agenda for a long time.
Okay.
And if I'm asked to vote on something, I need to be comfortable with it, and I'm not. And until I see real, consistent reform, real efforts at reform in how we treat people, in how we protect people, I'm going to vote against every one of these, and I want every one of these on the regular agenda moving ahead. And I'll just review each one as they come to see it. But tonight, C66 through C70, I want to our regular agenda.
Are you able to do that for us? Because normally the board member would pull it. Are you gonna go ahead and pull it then, each one?
What's required in pulling?
Well, you pull it up and then you say, I wanna flag it.
Flag for discussion.
For discussion, and it pulls it.
Okay, so, they're like mechanically, like how?
Yes, sir. And then that way,
Click on that flag for discussion.
right, and then it puts it into the regular agenda. It'll just change the
Gotcha.
number from a C to an R
Gotcha.
when we see it, and it'll pop it down.
Okay, I got you.
Okay. All right, so we were through 68, so let's go 66 through 70 then. And then item C71 through C72. And now we move to our regular agenda, R73 through R76. R77 through R80. Yes, sir, Mr. Harris?
77, the Lincoln Academy land donation.
Yes.
I have two questions. I was curious as to how a PTO ends up owning this property, number one. And number two, why would we want to accept non-contiguous property? This property does not abut the school, and it's across the highway, across the road. So what's the use of this property if it's not going to abut the school? And how in the world did a PTO come into ownership of land?
Ms.
I
Usher.
don't know the answer.
Ms. Usher said
Yes,
it's gonna
we
be
did
hard
work
to
with
shoot.
our
That's what I
outside
thought.
attorney to make sure, it took a long time to make sure the PTO was really the owner, and we got a warranty deed from them. The school brought it to our attention, and the reason, even though the lot is not contiguous, it's for teachers or parents, and there is a walkway that they can cross the roadway. This property is really constrained, Lincoln Elementary, so there are some parking issues, and the PTO purchased it and offered it to them for additional parking for teachers or parents, even though it's not contiguous.
Highly irregular, and I've never encountered that. Thank you for the explanation.
Okay.
Okay, any other questions in that group? Let's move on to R80 and R81.
Got a
Yes,
question. 80,
Yes, sir.
the community eligibility provisions, there was an attachment that listed school sites alphabetically, and every so often there was one that was highlighted. But I didn't see an explanation as to why some schools were highlighted, so maybe we can get an explanation for that.
Those were the ones been added for 18, 19.
New ones?
And they were added because those are schools with a high portion of their population being poverty.
Yes. Jenna, you want to explain how you highlighted those for the CEP? And can you explain the formula that's used as well?
Sure, so the 13 that were highlighted were added, those are the 13 remaining that have not been on community eligibility, and the only 13 remaining. So those were the 13 out of all of our schools that are not on the eligibility provision, and they are being added or proposed, we are proposing that they are added because each year we look at the numbers, and our past practice has been to add as many schools as we can while maintaining a high claiming percentage. This would be a 100% claiming percentage. It's actually higher than our current claiming percentage. What was your other question?
Well, the three columns I don't understand, identified student percentage and then the claiming percent, what's the difference? Because the numbers are dramatically different.
Right, so the identified student percentage is the raw numbers. Those are the students that directly qualify for the benefits. USDA provides a formula. So you multiply that number times 1.6,
Wow.
and that's how you know how to claim them at USDA for reimbursement.
Why would they have more than are actually eligible? Why would that formula increase, for example, 1.6 as a multiplier times Achievement Academy, 53.5%? Why would you increase the number? I don't understand. And I'm purely looking at this from a tax point of view only,
Sure.
the money.
The claiming factor, USDA provides the claiming factor at 1.6. It is supposed to provide a mechanism for taking students that are directly certified, and then eliminating the need to further do applications to find out what students might also qualify by doing an income verification form. So the direct certification, they do a formula, and then they come up with the claiming percentage, and it's supposed to provide districts a more efficient way of providing the services to the students and eliminating the need to do the free and reduced price application.
So that is what we are doing in lieu of finding out who truly needs help. So that's how the family that has a six-figure income, we end up feeding their children as a taxpayer.
Yes, and to put that into perspective, I have the numbers of the 13 schools. Out of the 9,453 students at those schools, 4,446 currently pay. So out of all of our students in Polk County, we have roughly 4,500 that are still paying full price for their meals. Of the students that are on free, the majority of them automatically qualify. We are currently doing 2 claiming methods to keep those 13 schools on a traditional system. And when we process free and reduced applications, there's only 734 students at those 13 schools that are qualifying based on the need application. So we are doing a lot of administrative work to ensure that 4,500 students don't get meals that they, as you put it, don't need at the free rate.
So we're willing to sacrifice that administrative effort in exchange for the tax dollars paying for all those kids' meals.
No, that's not the way I would word it. We are bringing additional federal revenue to our local economy because USDA provides that mechanism. It's a new way of looking at the process. Obviously, for years, free and reduced price lunch applications were the method used. This is a new way. It does certainly cut down the administrative burden, but we were able to look in October when, after Hurricane Irma, we were allowed until October 21st to provide meals free to all students. The counties that were most affected by Irma were given that ability. More students participated during that time. If you look at our increased revenue based on that, it would be roughly $2.5 million for a year, just based on the fact that more students will participate if they are provided the meals at no cost versus those 4,500 students having to pay the full price. So it is a significant amount of federal revenue. Yes, it is tax dollars, but it's what USDA is willing to give us, and those are federal tax dollars that we are bringing.
So to that point, I mean, taxpayers in Florida pay federal and income tax. They pay taxes.
Yes.
Those taxes go to Washington D.C., where God knows what happens. Some portion of that flows back to Florida in the form of the USDA school lunch program. Correct?
Yep.
That money's coming back no matter what. We can either capture that money back that our taxpayers have paid, including some people with six-figure incomes, or we can just kind of let it sit, right? That's our option. I think what Tip is probably alluding to is you look at the schools that are on this list, there are least poverty-stricken schools. But we're not generating that money from any kind of on-the-ground school-related activities. It's federal income tax that goes up to Washington and comes back. And it provides a service that cuts down on the administrative headaches for our people, right? I mean, we talk about how much our people have to do all the time. This is one of the things we have to do, right? So doing less of this saves time, correct?
And I don't want to focus on the administrative burden. I should have brought up first. I truly believe this is better for all of our students. And by eliminating one more difference for our students that are in poverty,
Good point. Okay.
it is now equitable. No one has to worry about whether or not I'm paying for my lunch or I'm not paying for my lunch. And I believe that is significant. That is more significant to me than the administrative burden. My staff member that processes applications will gladly continue to do that. It's a minor aspect of why I feel that this program has been very beneficial to our students. And the fact that we have 13, we've gotten to this point, it rather shines a light on the inequities of those schools compared to our others. This is one more way that we can remove that stigma and make them equitable, in my opinion.
Ms. Fields?
I remember when this was implemented, that was the rationale, is that a lot of kids were hungry, but they were embarrassed to go to the food line.
No matter how
Because-
hard you try, it is sometimes.
Right, and so by doing this, everybody had an opportunity, and so there wasn't any embarrassment, if my memory serves me correctly when we had this. Then the other thing is, not all of the kids are gonna eat lunches, they're gonna bring their lunches from home. So it'd be interesting to know what percentage of these students actually will eat the food.
And that's why I was alluding to in October, it was actually a nice little window into the student behaviors, because just during that window after Hurricane Irma until October 21st, at George Jenkins High School, we had a huge increase in the number of students that participated and purchased a meal compared to last October. You know, and every time we have added schools, the impact is greater as we add it at schools where the free and reduced rate was traditionally lower. So where you might have more lunch boxes, the impact is actually greater because parents obviously do see a benefit. They will then choose to participate in our program. They typically will get a healthier meal when they participate in our program as well. And going back to your point of when we initially have brought CEP, and every year when we have added schools, we have tried to add as many as possible. This was an opportunity where our claiming percentage allowed us to finally bring all the schools on. We can lock that in for 4 years and reevaluate, after that time as well.
I do want to say probably the high schools, there were probably kids going hungry because we knew for years, elementary, pretty much the parents would sign them up for free lunch, they would eat. But you would see at the high schools, very few, the free lunch would go down significantly. And that was truly because the kids refused to
It's more
sign up.
evident typically for
And-
whatever reasons that, it
And
was
so I
harder.
didn't think about, not so much for the elementary, but, and I'm not sure about the middle, but it definitely at the high school. I heard over and over again, the high school kids would not sign up for the free lunch.
And we took steps a few years ago, if you'll remember, when I presented our high school menu changes. We took steps to make it less obvious who was able to get a free meal and who wasn't, by making all of everything's available for a meal. We already took steps to make that less obvious at the high school level, but this is one more way that it improves that.
Okay, any other questions, comments? Okay. Hang on, just lost my agenda. Hold on, here we go.
The charter school.
Okay, so, the next thing I believe is our public hearing. Any questions for items R82 through R85?
Did we do the projected enrollment? Did you?
Yes.
Oh, okay.
I went through R81, yes ma'am.
Okay.
Did you have a question back there?
I just, the one thing I wanted to, because I've had a lot of back and forth discussion with Lake Wales, when we talked about Gibbon Street and the numbers, they felt that those kids never applied for Lake Wales. And so I just, when we're doing numbers for Lake Wales, I still haven't, we give them a certain number and they can add 10 more or not.
Right.
But Lake Wales is a different charter school situation where they're really the home school. Charter schools normally aren't the home school, but Lake Wales charter schools are their first choice home school. And when I just want to be sure we're not artificially cutting numbers off so that they are not able to take kids that, during the year that kids move in and out. Charter schools, typically, they only take kids in once a year. And then they have their enrollment because they're a different school. But in Lake Wales, when kids move in, do they have to go to another city to go to school because they don't have seats
Capacity?
available? Capacity, that's what I'm trying to say. And we're looking at these now and we're adding 10 to Polk Avenue. But I still want to be sure somehow it's a different kind of animal, lake whales. And I would like to be sure that any kids that move in, we don't deny them a seat.
And I agree with you, I know I asked superintendent, that particular one bothers me because our district recommended to deny it.
That's,
Okay.
that's my comment.
That's your comment, all right, so I feel like it's 10 seats here or there, is it worth the denial, just to send a message, oh, you didn't meet the 540 that you were at, because you were at 516, if I remember, I don't have my numbers in front of me, but it was something to that effect, so they get 10 more seats. My thought was, like yours, and I brought it up last time, that I thought, is it really that big of a deal to grant 10 more seats, and if they're able to get more children in, that'll be better for everybody to keep the children in the Lake Wales community, once again, trying to do that. So that's really a board discretion.
These are all up or down, right? Just one up or down.
Exactly, so you can either vote it up or vote it down. I'm gonna plan to not vote to deny it tonight, because I just don't think that's ridiculous, it's sending them a message for 10 seats, really? And all the stuff that we're trying to do to create the community, I don't know, I just feel like you need to continue to support it. Now, if there's major issues in the curriculum, I get that, I understand all of that, but we're talking seats, can't hurt, so why? That'll be up to each individual board member tonight. Okay, any other comments on 81 or 80 or 81? Let's move down then to our public hearing, R82 through R85. And I have one question, I guess, on the rezoning of Gibbon Street. Are we expecting a lot of, what has been your?
I can
You would,
report, we
please.
went to the community meeting.
Mhm.
I think, we have one employee that's still, I mean, she's accepting it, but she's unhappy. But literally, we had a pretty good turnout, but they had no questions. At the end, when they could line up to go to different stations to find out where their children were zoned, I noticed that they went to the stations. But, Michelle did a great, job in explaining it.
Okay.
And we were open to questions, and no one made a comment.
Okay.
So I don't know,
We don't know,
but
okay.
we had a meeting of the community leaders, and then we had an open community open community meeting at the school.
Okay,
And
went well.
it went well because no one questioned anything.
All right, thank you for that update for tonight. Okay, then next we go to our superintendent's report. And we do have an attorney's report this evening,
Yes,
sir?
ma'am, and I
Yes.
did want to let you know, there have been a couple of late-breaking requests for additional public hearings to be advertised, so I'll bring those to you at the time.
Okay, that'll be
Thank you,
great. And Madam Auditor, do you have a report tonight?
Not tonight.
Okay, thank you. Okay, and then we go to our board members' report, and then, of course, comments, folks having comments about addressing items that are not on the agenda. So that concludes our agenda study, unless there is any other questions? Comments from anyone?
We're gonna do board comments here.
Next.
Oh, okay,
Coming.
agenda stuff.
This was the agenda,
Sorry.
yep. All right. All right, so next, today, we have old business. I don't know of any. Does anybody have any old business that they need to bring before the board today? Okay, under new business, I do need to bring up one item. Our FSBA Legislative Committee needs a new delegate. Currently, Mrs. Sellers serves as on the FSA Board of Directors, and she can continue to do that through November. And then the FSBA Legislative Committee, she's also Hazel is our member, and in both of those I serve as an alternate. And so on the Legislative Committee, because there's a lot going on in
It's due now.
meetings,
It's-
throughout the summer, it's due. So I wondered if we had anybody
When
who
are
might be
your-
interested.
When are your meetings? Are there phone calls?
Many of our meetings, and I can give you the list, many of them are go-to meetings, conference calls. But we meet at both, in the December conference and the June conference. I can't promise that there's not gonna be a meeting in September, October, because we have in the past, but we've really, we had many weekly, meetings by conference, by phone, so you could do that from anywhere you are. And that's, that, but we are starting, and I have a board report tonight. They're trying to get it started faster this year, so they wanted the new members to be, voted on in June, so that they'd be ready to go in July 1st.
Is there a certain day though for the conference? I know when you had weekly conference calls in the past, they were like, oh,
We
it's on
did,
Mondays.
this year, we did, of course, they asked for, we tweaked them a little bit, but they ended up being on Friday morning at 9 o'clock or 10. We switched.
Wow, I think we have a really wonderful volunteer that has just stepped up. Ms. Reynolds, would you be willing to assume that role? Okay, awesome, awesome. Okay, and I can remain your alternate if you, does anyone else, would anyone else like to be the alternate for that? Certainly.
I mean, I'm happy to do alternate if it's,
You wanted to?
I would love to do it, the time is a problem for me, but I could be an alternate for it.
Would you like to be an alternate for Ms. Reynolds?
If it helps you, it's fine.
You're awesome. Thank you, sir.
I've got the form. If we're gonna
Okay.
vote on it tonight, we can add
Yes.
it to the agenda tonight as an emergency.
As an emergency item.
And, because it got away from all of us and they reminded me at our last meeting.
Can you have, are you able to add that as an emergency item for this evening?
I will try my best.
Okay, and if you would make sure that you put both Ms. Reynolds as the committee member and then Mr. Townsend as the alternate. Thank
I'm gonna
you.
give that to Susan. Susan can see it then.
Oh,
That's the form.
Perfect.
I don't need to fill it out
Get
first.
that filled right.
Yeah.
Then we'll submit it. Okay, next we move on to our board reports.
Yeah.
So, or board comments, I guess, today. So, how would we like to start? Who would like to start?
I usually go
Go
first,
ahead.
that's one, that's fine, but I'll defer to whomever.
I just have a quick one. I have been asked to participate in Celebrity Lip Sync Battle for PEP. It's October 10th. So I'm gonna be looking for backup dancers. Mr.
Backup
Hill, I'm looking at
dancers.
you. So just so that it's a really fun fundraising event. It's very similar to Stepping Out for Education, except it's a lip sync contest. So October 10th, if you've ever wanted to see me lip sync, that will be your opportunity.
Are you going to tell us what the song is?
They're going to be a surprise.
Oh.
But
okay.
if you want to be a backup dancer, you'll get to find out before everybody else.
For
So,
everybody else. So you've been tagged.
Yes, ma'am.
Okay.
Yes, ma'am.
Yes. Okay. Anyone else have comments?
Yeah.
Go ahead, sir.
I want to first bring up the K-12 issue. I've been trying to get some answers for this for about a month now. The fragmentary information that I've received over time leaves me, I'm unable to rule out the possibility that the former deputy superintendent, John Small, attempted to circumvent the board to create a contract or an agreement of some sort with a company he was about to go to work for. I want to be able to rule that out. No one has given us a satisfactory account of that. Mark Hutek says John Small told him to sign it. It's a $1.8 million sales quote or contract or deal, whatever it was. Mark Hutek says he then became concerned that with what he had signed, that he then took those concerns to the superintendent, and apparently the superintendent got concerned about what had been signed. That company months later, tried to bill us on that contract, apparently. They provided a payment schedule. At the same time, that company provided a press release for Mark Hutek to sign. I don't know who was representing the company when that was going on. Don't know why we have ever authorized any of our employees to give testimonials on behalf of private companies. I don't know what this portal is that I don't think I've ever voted for, but maybe I have. All in all, the complete lack of communication on this, the complete lack of a clear story as to what happened is very troubling to me, and I'm going to write a letter to the state attorney's office asking them to review it. I can't rule out that somebody sought to circumvent the board to do something really untoward. And I want to be able to rule that out. And I think the precedent for this, back when I first got on the board, and Kay and I exchanged a very innocuous email about scheduling, the state attorney's office came and reviewed that, and within a couple of days, we were both exonerated completely, and everybody saw there was nothing wrong. I would love to be able for the same thing to happen here. I'm gonna write that letter. I'm gonna write it on letterhead, under my name. I would love for the board to join me, because I would love for us to be able to clear the air on this. I'm asking the board to join. If the board doesn't want to join as a group, then I'm asking individuals to sign that letter with me. But either way, that letter is getting written.
Join you for, I don't understand, join you for what?
To ask the state attorney to review the entire K-12 issue.
That's your choice. If you wanna do that, do it on your own. I'm not signing anything.
I absolutely, I don't even understand the issue. Nothing was brought to the board. There was no contract signed. There was no, I mean, I don't know. The district office can talk to people, can look at stuff. Vendors come in all the time. I am totally confused because I happened to see your article and you indicated that we had signed it as a board, this contract. There was no ever any contract.
I absolutely did not. I said the opposite of that.
Well, I misinterpreted it because I was reading it cold. I hadn't heard anything about this. I am totally confused because after I read your article, I tried to find out. There was no contract. I don't know. There was some kind of price list given. I don't know. This is, unless something's brought to us and a contract is signed, people can talk and vendors come and go. I don't know how you're considering this circumventing the board when there's no contract that was signed without our knowledge. Anybody can come in and talk about their products and do things. I don't see where there's an issue when there was no contract signed. And if there had been a contract, it would have been for that amount of money, would have been brought to us. This, I don't even understand where you're getting this, because we'd only see it if a contract had come. How can you accuse them of something when doing something circumventing us when there was no contract? If there had been a contract signed without our knowledge for a product, I can understand.
Then it should be very, very easy for the state attorney's office to come in and say, Billy is crazy for thinking this, and everybody is exonerated. And, you know, I think that's what you all should do. No one volunteered that the deputy superintendent, the former deputy superintendent of the school, John Small, ordered his subordinate to sign something his subordinate was uncomfortable signing that had $1.8 million attached to it, and that they later tried to bill us for. No one ever told us that. And it's problematic enough that we can have people work at the highest levels of this district and then immediately flip over to vendors who are going to profit off of this district. That's a big problem. And it goes to the questions of disclosure I've been talking about forever. You guys were burned by the Acceleration Academy because you weren't paying attention to it. You were burned by the LIS system because you weren't paying attention to it. You were burned by Kathleen Leroy and Greg Rivers because you weren't paying attention to it. I pay attention to things. And if you're going to sit and wait to be told what's going on over and over again, the same things are going to happen. I'm not. And I have yet to have a good accounting of this. Nobody has stepped up to say what happened. Nobody has stepped up to say what Mark Hutek's concerns were when he went to the superintendent. Nobody has stepped up to say what happened in the meeting in the fall when the superintendent met with John Small, when John Small was representing K-12, not us. Nobody has said why we did a testimonial, why that was okay. I've got a million questions about this, and nobody wants to answer it. I've been playing cat and mouse with my own staff forever. The superintendent asked me to retract something, but she hasn't said what to retract. She's given no statement, no word. I want this cleared up. I want to be able to go out to the public and say, I know exactly what happened here.
And the only people right now I trust to do it are the state attorney's office. And I make no apology for that, and period.
Okay, the way I have understood it is that the K-12 was part of the online education system, and it's been in place in our district since 2009. It was put in place under Gail McKenzie. And from what I understand, there is no contract. It's a pay-as-you-go as the students utilize a particular course.
Then there should be no problem in having it reviewed.
True. That's fine. Write the letter, but I'm just saying, I don't believe, to my knowledge, there is no contract. It's a pay-as-you-go system, and the way it was explained to me is that quote that you're talking about was simply a quote, and he signed a quote, but we didn't pay for that.
They said the quote was in place for 30 days. 4 months after it, we had a meeting to establish that it wasn't a contract. If it was truly a 30-day quote,
Right.
why is anybody concerned after the 30 days is up?
Madam Chair, can I say something?
Yes, ma'am, if you could shed some light.
Members of the board, when that was brought to my attention late October, as I stated in the letter to Mr. Townsend, by Mr. Hutek, he brought it to my attention that it was signed as a sales quote, and that the company, actually at that point, I guess they were trying to say that it was a contract. It was not a contract. One, Mark Hutek cannot enter this board, buying this board in this district into a contract. That simply said a sales quote. So when he brought it to my attention immediately.
The only one who can bind us would be whom?
The board.
Would be the board chair.
Me bringing it to the board, which it never was brought to you because it never was brought to me. At that time, I told Mark Hutek, my first thing was, I'm gonna meet and let them know, as the superintendent of Polk County Public Schools, there is no contract. My signature is not on it, nor did it come to this board. That was expressed to Mr. Townsend in my letter to him, when he said that there was a contract or whatever he was writing in his blog. That was expressed to him. There was no contract brought to you. The only one was brought to you was what we have normally brought every single year, which is when the students utilize the product,
Yes.
they finish it, we get billed for what the students completed, and we pay that on invoice. Only, which is what we have paid.
Then do, okay. So I would then, it's up to you if you want.
John
I would just go ahead and write your letter.
John Small was the deputy superintendent of the school system. Presumably, he knows what he can commit people to or not. He then turned around and represented K-12. He told Mark Hutek to sign this, that he turned around and represented K-12. The superintendent just said they thought it was a contract. How can they think it was a contract if John Small was working for us and knew he couldn't bind us? It's fine.
But it was not a contract, because the only
Right.
way you
Right.
can get a contract is I bind the board, bring it to you, and you all approve it. You did not.
Well, I'm interested in John Small's actions.
You had to contact John Small.
Right.
You contact John Small.
Yes, Ms. Fields.
You know, there are three sides to the story. Mr. Small's side, Mr. Hutek's side, and the truth. Now, there isn't any way for us at this table to get to the truth.
Agreed.
If Mr. Townsend wants to go to the state attorney's office, then have at it. But as a board, as for me, I'm not willing to sign anything. And I don't know if you all are listening to how incompetent we are. I've been sitting here for the last year listening to how incompetent we are by Mr. Townsend. And literally, I'm kind of tired of it myself. If you all want to sit here and let him just badger us, then y'all do it, but I'm tired of it. I am literally tired of us being just ignorant. And I don't think that I'm ignorant. I don't think anybody at this table is ignorant. But at some point in time, as a board, we have got to take a stance, and we have not done that. If we're not careful, we're going to be without a superintendent of schools. We're going to be right back in the boat where we were before, if we're not careful. But it's on everybody that's a part of this board. It is. I don't appreciate the lies that's being told on me. I don't appreciate the accusations that's being told on me. And I am not gonna keep continuing to just sit here and just listen to one person say whatever they wanna say.
Thank you, Ms. Fields. Ms. Sellers?
I want to say something in defense of our superintendent. She's handled this. I don't know what the big deal is. She handled it. She handled it before I knew anything. I don't know how you knew about this because nothing was brought to the board, is my point, because our superintendent handled it. I don't know where you get your information, but this was a situation that our superintendent handled. She handled it, it's gone. It didn't cost us anything. I don't know who signed a sales contract, but our superintendent handled it. In your article that popped up, I don't search out the articles, you undermined her, you questioned her integrity when she has done nothing. She didn't sign a contract.
In what way did I,
And
what way did I?
the
I
way
question her
your
integrity?
article to me, I had not
Quote
heard
it.
anything.
Quote it.
I can't quote it for words. I'm telling you my perception is that, oh my goodness, the superintendent and John Small, according to you, had entered into some contract that the board didn't know about secretly.
I didn't say
I don't know.
anything about superintendent entering into a contract. I said nothing. I said
Well,
the deputy, I mean, you're
I said this is-
misrepresenting.
Okay, whatever, I misinterpreted it then, but that was my impression after I finished reading
fine.
it.
That's fine. Look, you know
That
what,
she hadn't done her job. I don't understand why this is even an issue. Things go on she is in charge of running this district. Things go on all the time. Things get misrepresented. You have to put out fires. It looks like she handled it. She took care of it. And I don't know what the big deal is. There's no cost. We're out of it. And I don't understand, and nothing was brought to us. I am in
Then-
total confusion about how a misrepresentation of whatever at the administrative level that our superintendent took care of months ago is suddenly an issue now. I don't understand what happened that she handled it with her people.
Well, in the
That's
effort of
what I don't
time,
understand.
thank you, Ms. Sellers, in the effort of time, because we really need to move on. We have a board meeting in 35 minutes, and we have other items to discuss. I would like to simply ask Mr. Townsend,
I'll write the letter.
if you'd like to go ahead and write the letter, and you're welcome to contact us through Ms. Susan to see if anybody else wants to sign the letter, if we could then move on, because I know we've got other items. So thank you both for being understanding here. I am trying to get through the list.
I'm not saying to.
Go ahead. You're up next. Yes, sir.
You know, some time ago, I asked the superintendent and Wes in December for a very specific kind of review of the Looney investigations. I asked this after attending a Florida School Board Association meeting and panel in which they talked about very similar situations, and they recommended in this kind of situation to get an outside review. I was very specific about the kind of review I wanted. It involved the institutional behavior toward the Loonies over time. It involved the issue with Laquita Looney and Juanita McCoy, which I'm going to come to in just a second, which we have never investigated. And it involved ways to come up with reforms, just disclosure reforms, HR reforms that would make the climate better for our people. Both the superintendent and Wes indicated they would move forward with that. Superintendent asked me if she could do it administratively, rather I had planned to bring it to the board. I said, okay, we'll see how that goes. At some point, they changed their mind, decided not to do it. I was never informed, never told. And then we've thrown together sort of a slapdash review that I'm going to come to in a minute. But I want to say first why this institution has no credibility. There are two dates that highlight why this institution has no credibility on the Looney issue at all. The first is August 31st. That is the date when Jason Looney held a mandatory faculty meeting at Tenor Rock High School while he was under active sexual harassment investigation. while he was under active sexual harassment investigation. Let me repeat that one more time. He was being investigated by this institution at that time. He held a mandatory meeting. Tim Harris attended that meeting. And Tim Harris said this. I have the tape and the transcript, but I'm going to read you the first 4 paragraphs Tim said. I appreciate that he's talking to faculty and witnesses, because there are tons of witnesses or potential witnesses to this in the faculty, and this is what he said. I appreciate those of you who were comfortable enough to send those emails, some of whom I did reply, and as a result of those emails, I felt it was important for myself and the superintendent to come out and speak with you and show our support and support of Mr. Looney. Unfortunately, the superintendent cannot be here. She has a very important family issue. It's kind of a little inaudible there. She's out of the office several days, so keep her in your prayers, please. I personally have gone through situations in my career, and I was with the school district for 31 years before I ran for school board, where I had a supervisor, let's say, just had a different paradigm from mine. I finally got to the point where I could handle the different paradigm because I decided that myself and that supervisor were always going to disagree. We just had a totally different philosophy of life. When I finally got to those mental positions with those 3 separate supervisors, I was able to deal with it a lot better and accept their differences from mine. It made looking for another job a lot easier mentally, unquote. He said that during a mandatory meeting called by the principal who was under investigation at that time for sexual harassment. That is, if that's not institutional witness tampering, I don't know what is. That moment destroyed any credibility any investigation was going to have. We have never investigated that moment. We have never asked Looney about this meeting, to my knowledge. It's never been looked at. We've never asked Tim. I mean, I've talked to Tim publicly multiple times about it. I have no idea what you thought you were doing. That's the first date that destroys our credibility in this. The second date is May 4th of 2018. That's about a month ago. That's when the state attorney's office dropped all charges against a woman named Juanita McCoy, who's an African American teacher who worked her way up from a para. On May 31st of last year, 2017, sort of the culmination of an ongoing dispute with Laquita Looney, there was some kind of issue where Laquita Looney accused her of shoving her. No shove occurred, but Laquita Looney called police immediately on that day. That African American teacher was marched out of her school that day. She was later suspended for 5 days without pay and forcibly transferred from that school. There was no HR investigation done. I asked for the HR investigation. What I was given was the police report. The state attorney's office, after Ms. Looney urged them to prosecute in August, decided to. When it came time for trial in May, they dropped all charges. At that time, I listened to the content of the tapes. Ms. Looney's statement is essentially a 20-minute HR gripe. She's complaining about ongoing things. Ms. McCoy, likewise, has lots and lots of complaints. I'm not really here to adjudicate their dispute, but they had a dispute that was two-sided. The only eyewitness to the case did not see a shove. The worst possible thing Juanita McCoy did was maybe touch her on the back and say, "Excuse me," as she walked past her. We didn't arrest her, but we had the police called. Because of that, Laquita Looney called the police directly. She told her principal, according to the principal, that she had been shoved into a cabinet. That is false. That did not happen. The eyewitness who saw it said she put her hand on her, but there was no jerk, no action, no force applied. Please listen to it. I have the tapes. I've done more work on this than anybody in this room. I've spent a year working on it. I'm completely unsatisfied with how this institution has dealt with this, and that's you know, here's my, and I have another question about Tom Gonzalez, who did the review we've just done. I've been asking for a few days now. He billed us for a sexual harassment training on July 11th, but it looks like the sexual harassment training was actually done on June 22nd. And for me, I'm trying to get a sense of when that was. You know, was it June 22nd or was it July 11th? And can we have the sign-in sheet for that, because it's actually relevant to some of this?
Yes, it was actually June 22nd. His bill is dated July 11th, and that's the discrepancy in the date.
Right.
And we actually do have the sign-in sheets as well. As you know, Ms.
Right.
Clayton has been out dealing with a personal issue, and that's why it has not been delivered to the entire board.
Well, I think I've reviewed your thing. You said it happened on July 11th, when in the written content you provided. So you're saying it didn't happen on July, that nothing happened on July 11th at all. He did no work for us.
Correct.
And
So-
and
So let me ask, so we can come to some closure. I understand everything that you said today. What is it that you're looking for? Trying to get to the point here, because we've got discipline in a board meeting. Help me out. Are you wanting?
I wanted,
What are you wanting?
I asked the superintendent to wait till this meeting to do any kind of review so that we could agree on a scope. I've been very clear about the scope that I want.
What?
I want an outside investigation of the Laquita Looney, Juanita McCoy issue. I want a review of the institutional behavior toward the Loonies, going back 10 years, and I want recommendations on reforms, on how we're going to get better, on how we're going to deal with disclosure, on how we are going to, because it seems like we learned no lessons whatsoever from the Kaplan Roy issue, and I'm sorry, I'm just not going to say that we did, and I want someone. The person who performed the review, Tom Gonzalez, is a long-standing management attorney for us. We have a long-standing financial relationship with him. For the public and teachers out there listening to this, he is the guy who appealed over and over again the master's degree pay and cost us all lots and lots of money in fruitless appeals. His review is absurd. Plus, he was belligerent to me. He kind of called me out of the blue and I sent him a link to something I'd written. I was trying to clarify, and I want somebody I can have some trust in, and I'm open to discussing that.
Okay, so as one board member, even though I'm chairing today, as one board member, my question would be then, I would want someone to give us a cost, because we're talking dollars here, money that's already been spent, right, on the initial investigation, and then this other gentleman. I don't have my hands around the finances, but before I would go to a full-blown, is that what you're saying, investigation of the 3 items you just said? I would want to know how much that's going to cost, and that would have to be a board decision, am I right? I mean, okay, Ms. Sellers?
We as boards, if you look at our job and our scope, we are getting into our superintendent's job. I just had board training by a lawyer for another board I sat on, and what we're doing here today and what we're discussing is absolutely not what a board is doing. We're discussing individual staff members that belong to her. Yes, we paid for an outside investigation to investigate our investigation. They noted on here that you tried to give them tried to taint it with his own
I tried to
view.
taint it.
No, the footnotes on here say that you were talking to them about the investigation during the investigation.
He called me.
About something else, and then you started talking about, he didn't call you about the investigation. I'm clearly reading what he wrote.
He said, do you have something to add to this review? He asked me that. I said, yes, I have a timeline that I did. Here, would you like to see
He wrote something different.
Well,
So-
there you go.
I don't know, but this is not what a board is supposed to be talking about at all. We're taking
I literally
the
got the
authority.
idea from this from the Florida School Board Association. I went to a panel and they said, if you have a high profile deal that involves like a school board member going to a high school and talking to witnesses to sexual harassment investigations, you probably should have that reviewed outside. That was, I have been so patient in this. You know, and look, if y'all don't want to investigate it, what you should say, all of you should right now say, I have complete confidence in how the district has handled this. You should all go say it. I have none. I have no confidence in Looney's leadership at Tenor Rock High based on the research that I've done, and I have no confidence in how this institution has handled this. If you do have confidence in both of those things, then you should say it. I think you owe that to the public. You know, if you want to vote down a review now, it's fine. We'll let it play out in the public, and people can make their decisions on it, and we'll just go. But I do think you owe it to people. You owe it to the public who elected you. I think I owe it to the public who elected me to let them know where you stand on this.
Thank you, Mr. Townsend. Any other comments, Ms. Reynolds?
Ms. Bird, can you estimate at all how much time has been spent by staff on the requests that have been submitted since the last board meeting?
You talking about from board member?
Yes.
It's been quite a bit of time. I can tell you on one request, you have multiple departments trying to pull information for several hours. So if you had to calculate, it can be, I would say, about 10, you know, between 10, 30 hours could be on all since last board meeting.
And that's hours that they're not doing the job that they're assigned to do.
Correct.
At what point is it, I know I've been told that in policy, things can come to the board if we're wanting a significant amount of work to be done by staff. At what, is there something more that we need to do to support staff on getting this information, or when information's requested, if it's being requested by the full board as opposed to just by individual board members?
I think the board can have a, Wes, am I correct about that, board policy, or come to a consensus when it's becoming?
In general, if there are items that require an extraordinary amount of time, those are things that the board, that the superintendent can bring to the board and ask, do you wish to dedicate that much staff time to it, or not?
I mean, as a board member, before we go to use an exorbitant amount of staff time that they need to be doing their jobs, I would hope that you could bring some of those things to us. If you know, if it's something that's gonna take 10 minutes to pull information, obviously do it. But if you can look at the request and see, okay, this is gonna take 20 or 30 hours of staff's time that they need to be creating staffing plans and interviewing guardians and that type of thing, I wanna make sure that our staff is doing their jobs and doing them well, not just
Is that the consensus of the board,
figuring
that
out
I
what's
bring it
happening.
to the board when it becomes so much?
And I think we decided that years ago.
We did.
That is the policy. We actually created one. Yes, we did.
I will bring it to the board.
What is this policy we're bringing to the board?
It's simply a policy that we put in place. I don't have the wording. I didn't look it up today. Something to the effect of, and hopefully we'll get it, that if one board member requests information and it's deemed as going to take a lot of staff time, that it would make sure that all 7 of us would benefit from that same information.
No, that's not the policy.
No.
The policy says that if a board member comes to the superintendent and wants a lot of information, before that is even done, it has to come before the board for agreement that board member can get the information.
That's what I said, that all 7 of us agree that we all want that information before she spends staff time putting it together.
I'll have Joanne, when she returns, pull the policy and send
Perfect.
it to all board members.
Send it to all board members and we'll go from there.
I will.
Okay.
Thank you, and we'll make sure we
Go from there.
bring it to the board for consensus.
Okay.
Thank you.
Anybody else have anything to bring up in their comments? Okay, if not, then our work session is completed, and I would ask if everyone could be a bit expeditious and leave in the room, because we're going to go ahead and have our discipline meeting right here in this room. Yes, take care of it, yes. They've already, yes, yes.